Supervisors for Dubuque County into session for Friday, January 29th at 2021 at 1 p.m. These will be budget hearings, and so budget sessions. I'll turn it over to Stella.
Good afternoon, everyone. We have on the agenda today a presentation from Cottingham and Butler representatives on our health insurance plan, and then we'll do departmental presentations from Conservation, Sunnycrest, the County Attorney, and Facilities. And then we have a procurement procedure at the end that we need to get to, off budget topic. So at this point, I'd like to just turn it over to, we have Sarah Dickinson and Mike Johns here from Cottingham and Butler to talk about our health insurance plan and the renewal. So are you able to share your screen, Mike or Sarah?
Perfect.
Let me know if everybody.
Yep, there it is.
All right, well, thanks for having us, and we'll try to keep this short and sweet. Do you have a time limit for us, Ian?
Stella, what are your thoughts on that?
I kind of put in about an hour, I believe.
Okay.
There's no hard limits on anything, but we kind of plotted it out. So I was thinking about an hour for you guys.
Well, we hope we don't make you listen to this for more than an hour, so we'll try to keep it to an hour or less. I don't know, Mike can get pretty windy though. So we have quite a bit to talk about. Again, Harley, nice to meet you. Ann and Jay, thanks for having us. We are going to go through, Mike, can you maybe turn to the agenda page? We're going to go through, kind of a historical recap to bring everybody back up to speed on where we're at today and how we got here. A plan year to date. So since our last renewal, how are we doing and how are we running? We have the renewal. We're going to talk about some strategies that we've discussed in the past, but bring them back to the table. And then we've got some additional details in the appendix in case we need them. We did just have a health insurance committee meeting earlier in the week, and we think that went well. So we can share what we discussed in that meeting as well. So I think, Mike, maybe we just jump into the historical recap. And remember, this is Harley's first time with us. So, make sure that we talk in a little bit more detail, maybe to bring him up to speed on where we've been and how we got here.
So the executive summary, I won't read this line by line. Dubuque County has been with the Iowa Community Trust for about 5 years now. And the first year, the inaugural year that the trust was put into place, the county actually had a proposed reduction to the budget because of the savings that the Iowa Community Trust brought. The next couple subsequent renewals were very good. We had a 0.5% increase and about a 4% increase. Last 2 years were a little bit higher in terms of the renewal projections from Wellmark. So 2 years ago, which would be the 2019 to 2020 plan year, there was an 11% increase for the Wellmark portion of the premium. And the overall projected increase from Cottingham and Butler was about an 8% increase. And 2 years ago, Cottingham and Butler was able to perform some analysis and to make the recommendation to Dubuque County to shift their risk to take on more exposure. So we basically said, buy less insurance from Wellmark, put more exposure on your claims and you'll save money. So the county went from buying a $5,000 deductible from Wellmark to a $7,900 deductible from Wellmark. So they took on about $1.9 million in additional exposure, and it ended up saving you about $234,000. That's what the exposure ended up saving you overall. So that was a good move. It actually took the renewal from an 8% down to a 1% renewal. So that year we were able to save the increase from Wellmark by taking that additional exposure. The next subsequent year, the Iowa Community Trust had about an 11% increase, and that ended up being a 9% increase overall to Dubuque County. That year, we Cottingham and Butler shopped that increase, and we'll kind of cover our marketing efforts and what we were able to do over that 2 year period. We had a lot less ground to shift on exposure. You were already maxed out for the exposure that you could take for a federal allowable limit. So we looked at self-funding. We looked at Wellmark Direct outside of the trust. We looked at United Healthcare. We looked at UMR, every available option, and basically concluded that the trust in its renewal was the best financial option for Dubuque County. And what we did look at last year was looking at alternative strategies to manage your cost other than just the funding mechanism, which right now you are split funded using Wellmark and Cisco using an HRA buy down. So other than just talking about being self-funded or going fully insured, we looked at other strategies to lower the county's overall cost. And so we'll review some of those strategies as well.
And Mike, just to take a step back. So Harley, when we talk about the Iowa Community Trust, what that means, if you're not as familiar with kind of different funding mechanisms of insurance. So prior to being part of the Iowa Community Trust, Dubuque County had been with another trust, and prior to that, they had been direct to carriers. So when you're in a trust, it means it's actually a trust that Cottingham and Butler started, and it's for cities and counties in the state of Iowa. And it basically allows the county to pool together with other cities and counties so that there's more employees involved and we can kind of spread our risk. We're a bigger group to Wellmark. So that's basically all that trust thing means. And when Mike's talking about going out to market, we always look on an annual basis of, does it make sense to stay in the trust, or does it make sense to get out of the trust and go back direct to the carriers? Sorry, Mike, go ahead.
Yep. So the next couple pages, really just the detail behind what I just explained. So, you know, the way we lay these out is it gives you the current, the renewal, and then basically where the renewal ended up. So this was that year where the county shifted from a $5,000 deductible up to a $7,900 deductible. And you can kind of see overall we reduced the premium that we were paying Wellmark by $500,000. So that brought the overall renewal down significantly. We just purchased less insurance, put more money on the HRA claims, and that saved that subsequent renewal. The next year, we ran out of real estate to make those shifts. So the federal allowable limit that year was $7,900. We were capped out with how much exposure you could take in a fully insured environment. And so we did not have that same ability to shift costs that year. So your overall increase ended up last year being a 9% increase. 9%, just to give you an idea too, is about $500,000. So that was the overall projected increase last year. So the two renewals, you know, anytime we get any type of an increase, we, Cottingham and Butler, want to make sure that, again, you're in the right funding arrangement, you're with the right carrier, you're doing the right things to make sure that that renewal is mitigated. And so our marketing efforts over 2 years were pretty significant. For the 7/1/19 to 2020 plan year, again, we marketed to United Healthcare, fully insured, self-funded. We marketed to UMR, which is a self-funded wing of United Healthcare. We marketed outside of the trust to Wellmark on a direct basis, on a self-funded basis. We marketed to medical associates, and then we marketed to all applicable outside stop-loss carriers. Pretty well every reasonable carrier or arrangement that Dubuque County could assess or look at, we looked at. Just a little bit more detail as to where we all went and some of the different carriers, stop-loss carriers, and even inside of carriers like Wellmark and medical associates, we looked at different network options as well. So that's tightening the list of providers or where employees could go and seeing if any of those arrangements would shift costs appropriately.
Any questions so far by anyone? Okay.
So next page is kind of deep, and I'm sure Jay and Ann are probably having flashbacks because, again, there was a lot of information. There was a lot of financials that were covered, but you know, really when we looked at the trust and the renewal and all the available options that were out there, by far the best option was the Iowa Community Trust and the renewal, even though it was a 9% increase this last year. And so that was the increase that was taken. It ends up being about a $5.6 million overall budget, and that's the year that we're in right now. And you can kind of see if I were to be self-funded, I had budgets upwards of 6.2 and 6.3 million. If I would have gone direct to Wellmark, just left the trust, gone to the same arrangement, same plan, same everything with Wellmark, the proposed cost was 6.3 million. So what that should tell you right away is that the Iowa Community Trust is subsidizing Dubuque County's costs. Your costs are lower inside of the trust, which includes 14 other cities and counties that pool together to buy insurance. And that's kind of been the case over the last few years. The last two trust renewals in particular, where Dubuque County has ran hotter than the rest of the groups. And when your claims are pulled in with theirs, your costs are actually lowered overall. So that's kind of why we're seeing these results from the market. So now we're into this plan year's update. So how are we running right now as a group? So if you look at the HRA claim layer, this is the risk layer that Dubuque County takes. So if an employee goes to the doctor, they're on the hook for the first $300. After that, the county pays anywhere from $300 all the way up to $7,900. And once claims hit $7,900 or greater, Wellmark picks up the rest. So your HRA claim layer, we budget about $1.2 million in spend. And historically, we've been very below budget. And so you can see the blue line, the light blue line represents your HRA claims and the dark blue line represents the budget. And we budget conservatively on purpose because you can see there are months where claims go above the budget. Dubuque County has to have reserves on hand to pay those claims. And so we do need to have a conservative budget that accounts for having claims on hand to pay in a month where budget would go over. You can also see the other thing that we talked about where back before July of 2019, Dubuque County had a $5,000 deductible. That was your risk layer that you were taking. And in 7/1 of 19, we shifted that up to $7,900. We had you take more exposure. We also changed the budgeting methodology. We tightened it. And so you can see what happened. You were way below on HRA claims. We shifted the exposure up and we tightened the budgeting, and you can see you're much tighter to the budget now. You've averaged about 73 to 74% to budget over the entire period that you've ran HRA. So that's about 317 grand below budget. So even though we tightened the budget, even though you took more exposure, the HRA layer is still running very well. On average, you're well below budget. Any questions with that? So this is the layer of claims that the county is funding. These claims are funded on a weekly basis. Cisco is the administrator, right? So if somebody goes to the doctor, they present their Wellmark card. Basically, these claims are paid for. They're funded weekly by the county. Cisco pays the provider. All the claims coordinate with Wellmark's claims. So this is what you're funding. This slide is what Wellmark is funding. So this is just looking at the premium that you pay Wellmark to buy that $7,900 deductible plan and the claims that Wellmark pays out above $7,900. So you can see the premium that you pay Wellmark is in dark blue on a monthly basis. It's averaged about 320 to 330 grand a month historically. And in dark red, you can see the claims paid by Wellmark on Dubuque County in that month. So you can see historically, you've had months where you have had 200% loss ratios, 150% loss ratios. This period where we start to see this drop down, particularly right here, this is kind of where COVID hit. Back if you think about March, April, May, June, we saw significant reductions in claims during those periods. And then we saw a rebound in those claims in the in the next subsequent periods. And so the fluctuation explanation right here, I would chalk a lot of it up to COVID, where we saw on average between a 20 to 30% reduction for office visits, physician visits, any type of planned surgeries, any type of planned outpatient procedures. Those base layer of claims reduced 20 to 30%. Large claims still happen. Cancer still happened. Those claimants still came through. Right now, plan year to date, Dubuque County has 12 claimants over $100,000 or greater. So if there was a large catastrophic claim, it still happened, but the reduction in those visits and the reduction in those planned procedures caused a big drop in claims and then a spike back up in the fall. But you can see overall what's going on and how I kind of described what I'll call the loss ratio. And that's just the term for how much premium did you pay Wellmark and how much in claims did they pay back? So if you think about the loss ratio from July of 18 through June of 19, Dubuque County ran at 105%. You paid Wellmark $4.2 million in premium and they paid out $4.4 million in claims. So 105% loss ratio. The trust's loss ratio was 103. And that includes Dubuque County inside of that, who is the largest member of the trust. The next subsequent year, which includes part of that COVID period, the main part that spiked down, which is April, May, June of 2020, you had an 87% loss ratio, so claims got better. The trust's was 84%, which also includes Dubuque County. And then since July of 20, so the most recent 6 months of activity, you've ran about a 98% loss ratio, but the ICT has ran a 78% loss ratio. So those are the plan year period loss ratios for the county relative to the trust. And I mentioned before, when we quoted the county outside of the trust, direct with Wellmark, with the same plan design, the same everything, the rates went up relative to what you're paying today. We also had confirmation in writing that the other 13 Iowa Community Trust groups rates would have gone down had we pulled Dubuque County out of the trust. So the trust right now is about 14 total groups. I think there's close to 2,000, a little over 2,000 total members in those groups. Dubuque County represents about a fourth of the overall trust membership now. Any questions on that? Okay, a lot to look at here, but what we're looking at is overall gross cost. And this is gross cost in dollars, right? It doesn't account for employee growth because you have had slight employee growth at the county over time. But if you look back to 2015, the county was paying 4.4 almost million in premium to Wellmark. That's what fixed costs are right here. And you were paying about 419 grand in claims. Those are HRA claims, right? So if I add those two numbers together, you're about a $4.7 million overall cost. This was the budget for that year. This is the next year's actual. This was the budget, next year's actual budget, next year's actual budget, so on and so forth. So you've got a historical context as to what the costs have done. We remained almost relatively flat over these periods. And in the last 2 years, I've seen a little bit more of an uptake in the premium. So 4.8 million and 4.4 million right here. If you look at your cost over a 5-year period, it has increased about 800 grand, not accounting for employee growth, which is a 4% trend overall. So if I think about that and what I see in the industry, most underwriters are applying medical and prescription drug trend numbers at about 10%, which means if I go to the doctor and I have a $1,000 claim, next year the same claim is about $1,100. That's medical and prescription drug trend. You've averaged 4%. So you have significantly outpaced medical and prescription drug trends on overall cost, not even accounting for employee growth. And so when I start to look at employee, I have to look at it on a per employee basis. So I'm literally just taking your overall gross cost, dividing it by the number of employees per year. And you can see you were at 13,500, 1, 2, 3, 4 years in a row. You had almost no cost per employee increase over a 4-year period. Within the last 2 years, what we're starting to see is we've almost ran out of runway for making tweaks inside of the funding arrangement that we're in. So if you remember, I talked about shifting cost from 5,000 up to 7,900 and how much money that saved. Only a couple years before that, we shifted costs from 2,500 up to 5,000. So Dubuque County continued to take additional risk and continued to win on the overall cost savings. We're out of runway because you've kind of reached the federal allowable limit for how much risk you can take in a fully insured arrangement. You're at 7,900. The federal allowable limit for 2021 is 8,350. So you can take an additional $450 in risk, and that is it. And then you're tapped out as to the deductible and the out-of-pocket that you can buy. So why we started talking last year about alternative cost-saving measures is because we had marketed to every carrier with every arrangement, to every network option available. And our assessment is the Iowa Community Trust, as long as your claims continue to run above it and continue to run a negative loss ratio with Wellmark, that is the best funding arrangement that you should be in. Self-funded would cost you more. Direct with Wellmark would cost you more. United Healthcare would cost more. So we have to start to look at alternative ways to measure, to save cost, which could include a variety of different things. And so we looked at deductible shifts. We looked at premium shifts. We looked at different strategies to attack coverage and to subsidize people that don't need the insurance. And so we'll review some of those later on, but that was our methodology for why we talked about those things last year and started to introduce them to the county. So if we think about the plan design and the costs that you're paying, Dubuque County has a $300 deductible for singles and a $600 deductible for families. And you also have a $300 out-of-pocket maximum for singles and a $600 out-of-pocket maximum for families. So your plan has 100% coinsurance. If we take your plan and put it on the federal table for how they grade the value of plans, which is called minimum value, which if you look at the federal exchange or any of the state exchanges, they put those in metallic values: platinum, gold, silver, bronze. Dubuque County's plan is a platinum level plan. It's designed to cover 93% of the overall cost of coverage for employees. It is a significantly richer plan than what we see with most other benchmarks. And so what you've got here is the Midwest plan average, the Mercer national average for government, and then the Mercer overall national average for all employers. And what you'll see is the government employer average has deductibles that are a little bit higher, $500 versus $300, but the out-of-pocket maximum is $3,000 instead of $300. There's almost 10 times more. And so that has a value of 87%, which I'd probably classify as a high gold plan versus a platinum plan. And yours is 93%. If you go to the national average, it drops even more. So that is to say the government averages are just richer than what all the national averages are for benchmarks. And then the Midwest, that is plan design, not out-of-pockets. The other piece to your costs are employee rates. So you can see down here, the employee rate for a single is about $47. And the national averages are all at 108, 104, and 156. Families is an even more significant of a difference. So average family on the county's plan is paying 111 versus 427, 394, 607 on a monthly basis.
The bottom line, I'm sorry to interrupt, Mike. Bottom line, the county has historically and currently offered a extremely great benefit to employees at an extremely low cost. And that has been by design. So you might be off of benchmark, but there is a value to it. And I think the county has done a very nice job over the years of really explaining the value of the plans and what employees get. Especially with the health insurance committee. The health insurance committee members do a really nice job of educating their people on what changes have we talked about, what's in the pipeline, and how great is our plan that we offer. So although we're talking about how rich the plan is, more so than the rest of the world, it's been by design. Any questions about that? We do draw a lot of attention to this Mercer benchmark. So when we talk to the health insurance committee, we do go into detail about, you know, how the rest of the world, if you look at government averages, Midwest, national, how much higher the out-of-pockets and deductibles typically are. So we talk about those opportunities to save dollars if we make changes to the plan design. Sorry, Mike, go ahead.
All right. So we'll get into now the Iowa Community Trust and the Wellmark renewal for 7/1 of 21. So the overall projected renewal increase for Dubuque County is about a 4% increase overall with the Iowa Community Trust. That includes a 5.6% increase from Wellmark and no increase projected for the HRA layer or any of the HRA costs. So that increase equates to a $265,000 overall projected increase, or 4.4%. Cottingham and Butler did get a alternative quote, well, two alternative quotes from Wellmark. We did get a quote shifting the deductible from $7,900 up to the max, which is $8,350. It would lower Wellmark premiums by a projected 0.9%, which was about $56,000. So there is still a small opportunity to shift a minimum amount of risk onto the HRA layer and to save a little bit in Wellmark premium. Any questions on the renewal, any components, anything on here? Good. All right. Sarah, I don't know how much into detail you want to.
Yeah, so if we look at this continuum, all the way on the left is if you're fully insured, and we've been just fully insured in the past. The second column, HRA buy down, that's an explanation of what we're currently doing, being split funded with an HRA buy down. And then there's level funded programs. That's kind of a hybrid between fully insured and self-funded. There's captives, which captives is an alternate funding mechanism, kind of as groups, kind of like a trust. Cottingham and Butler has actually recently started a captive as well. And we have not talked in great detail about that. Captives are sometimes tough for municipalities to participate in on benefits because you actually have to buy shares into the insurance company. But we can always talk about that down the road. And then all the way on the right end of the spectrum is being self-funded, which we've talked in some detail about as well. But just some additional details on those different types of funding mechanisms.
So just some observations before we kind of start to talk about some of the alternative cost strategies. The funding mechanism with the Iowa Community Trust and the HRA buy down, we still believe is the best fit. We did get an alternative self-funded quote from Wellmark again that had very similar financials as to what last year's quote did. We project your costs would go up being self-funded. And again, the reason is because right now, over a multiple year period, you've paid more Wellmark has paid more claims than you've paid them premium. So you're a negative loss ratio or right at 100% loss ratio. Your claims are your claims. If you shift those over to self-funding, you pay 100% of them. No trust subsidizes your claims and no premiums to Wellmark are capped. So we do have your costs and Wellmark has your costs going up in a self-funded environment. Now, moving to self-funding would give you greater flexibility with plan changes and what you want to do with your plan with controls. But benefit to benefit, your costs would go up being self-funded. The Iowa Community Trust transitions the last few years where we've advised that you take on greater risk, they've paid significant dividends. You've saved money. We're out of runway, right? So that $450 additional risk that can save the 0.9%, that's it. And after that, we have what I'll call maxed the funding mechanism or the optimization of what we can do inside of this. We've maxed it out. And so now we need to start to look at where else could we control your costs? And the first places we like to go are trying not to change benefits and trying not to increase costs per employees. So where can we create win-wins where we can lower your costs but not take something away? That's the first place that we try to look. So if we look at the county right now, you have on average about a 97% participation rate. So of all of the employees that are eligible for insurance, almost every one of them always take the county's plan. And the reason is really it's supply demand, right? You have a platinum level plan that is half or a fourth of benchmark in most cases. Everyone is going to buy it, whether they need it or not, whether they have access to other coverage or not. So that's what we see happening. The other piece is when you have family coverage that is so affordable and so strong, it's a fourth of benchmark for premiums that are charged, and it's a fourth or a fifth of benchmark for overall costs. More families are going to join your plan. So you're going to carry more belly buttons, and every belly button has a cost. And so on average, you are carrying 2.9 belly buttons per enrolled employee. You're carrying a lot of dependents and a lot of spouses on your plan. So you've probably heard in the news of strategies like spouse exclusions, where there are school districts, government entities, many businesses that say, If your spouse has access to other coverage through their employer, they have to take it. They're not eligible for our plan. And the reason that works is because from an employer standpoint, the number one coverage I subsidize the most is the cost of single. Single is the lowest cost. That's my highest cost share percentage as an employer. I throw the most money at covering their costs. So typically, doing a move like that doesn't shift costs up for most people because singles are heavily subsidized. But there are other provisions that are available that can help control that dependent ratio that don't take things away. Overall, again, the county's paying a higher percentage of cost and offering a much richer plan design than every benchmark that we could show you. It is one of the richest benchmarks in our entire book of business that Cottingham and Butler manages. And so although you're offering that great benefit and a very low cost, your costs are still good overall on a per employee basis, and your total gross cost, your costs are still good. And you're looking at a 4% increase, which is a good increase as well. So there's not a dire reason to do something drastic, but if you start to make these changes year over year, you'll not run into a year where you have to do something drastic, if that makes sense. Sarah, anything to add to any of that? Anything I missed?
No, I think that's good.
So this is what we call our 3C analysis. And this is actually the first place I go. If I'm asked to dive into costs of a health plan, this is the first analysis that I do. Whether it's a city, a county, a Fortune 500, a Fortune 100, it doesn't matter. This is our stepping point for how we look at your cost. The first thing that I look at is coverage. It's those two metrics I talked about, your participation rate and what I'll call your dependent ratio, or how many belly buttons you're carrying per employee. And what we want to do is we want to assign a value of how far off of benchmark are you and how much is it worth? And that's all this is. This is a math exercise. So you are at, right now, you're at about a 94% participation. That number tends to fluctuate just based on new hires. Benchmark for governments, which is a rich benchmark, is about 90. So if you were at 90% instead of 94, that's about a $210,000 delta. That's how much extra we're spending by carrying that additional 4%. The dependent ratio of 2.93. So again, I'm carrying 2.93 dependents per every enrolled employee. The benchmark is 2.1. That is a $1.5 million delta. So the amount of spouses and children that you're carrying on the plan relative to another average state and local government is $1.5 million in extra cost. That is largely due to the cost of coverage for dependents being about a fourth of what the benchmark would say. So again,
Yeah, that's directly correlated to the, it costs a family of 2 people or 10 people $111 to be on your health plan. And so anytime you have a very low family contribution, everybody's going to be on your plan.
the cost sharing is the next metric I go to. So cost sharing is in two components. What do employees pay in premiums? And what do they pay in cost sharing with your plan? Deductibles, coinsurance, copays. Those two numbers together, your overall cost share, the county's covering about 87% of the cost of coverage, and employees are covering the other 13%. So if you break those two components individually, your plan design is a 93, the benchmark is an 87. Your premium contribution is a 93, the benchmark is an 80. So that's kind of breaking apart premium cost sharing, plan design cost sharing, combining the two and looking at two at each individually. So this is kind of where the math shakes out of where your opportunities are at. And you can start to kind of draw correlations as to how these have interaction effects with each other, right? It's pretty simple supply demand. Rich plan, low premiums, drives high participation and many dependents. So the question is, what can we do about it without charging employees a lot extra or taking away benefits? And that's kind of what we try to approach for cost. But before we get there, it's pretty common for employers to pass on small increases in premiums year over year, right? And even if employees keep the same premium percentage, their costs still go up, right? Because it's a percentage of the overall cost. So what we wanted to do was tables so that everybody understands what the cost sharing looks like from a premium standpoint. So right now, on average, and this is just kind of a snapshot average, there could be small discrepancies between business units and sheriffs versus road crew and so on. But on average, a single pays about $44 a month. And on average, a family pays about 102. So the county is collecting about 393 grand in estimated premiums in a year from employees and families. That's 7%. So if we take that same 7 and apply the renewal, the cost for them goes up $3 a month and $9 a month. That's without moving off of that 7% cost share. If I move up 1% to 8, their cost goes up $10 and $25 a month. So the county would collect an additional $36,000 in premium. If you jumped all the way up to the government benchmark of those premiums that we showed, the $104 and the $394, you would collect an additional $1.05 million in premium. That's how far off of that government average you are. So that's where that cost share number on this page kind of comes from. So just an idea. And I don't know, I don't know if we're still in the bargaining unit that the percentage is going up this year or not, but I think historically when it does go up, it goes up 1% each year. Any questions on that?
I have a question. Dawn, can you address that while we're right here in the moment? Can you address the percentage increase?
The percentage increase that we have to negotiate is only for the 2 public safety under PERB. Those are the only ones that we still have to negotiate with that with. With the sheriff's deputies, we locked in increases during that 3-year contract. And so they will experience, they just experienced another one on January 1st. I'd have to go back and look. I think they're like at 55 in 115 or 120. And then they'll have another one in the final year of their contract. The admin deputies, we negotiate every year, so we will have to negotiate that. For all other employees and all other, so for non-bargaining and all other bargaining units, we set, you as the board set what that percentage is, and it's currently 7% for all of them. We do not have to negotiate that with any other bargaining unit.
But all the other units have gone up to like the 8% you're saying?
They're
Right?
at the 7%. And these premiums are not necessarily reflected coming out of their checks. This is only for health insurance. They do cost share on the dental, vision, and life insurance as well.
Right. I thought you said the deputies just moved.
The deputies just moved. We have negotiated that. We negotiated a 3-year contract with them. In each of the years, we negotiated an insurance, an employee cost premium increase. The admin deputies will be negotiating with them here yet this spring.
Deputies went up 1% every year then, or?
We have a flat dollar amount with them.
Oh, okay.
We did that with them.
And the other thing.
Yeah,
just
Harley,
so- Go ahead, Jay.
I tried to, when we first started the increases, my goal was to keep them all the same across divisional units, and then quickly that went out the window. So yeah, there's a lot of different percentages out there, but you know, Don, maybe you can talk about historically just where we started. I think it was at 5%, and then we did go up to about a percentage point a year for non-bargaining.
That is correct. We have not gone up. We have been on 7% for the last 3 years though. And that is just a board decision if you want to increase those. For all but the 2 bargaining units, those we would have to negotiate. But that doesn't mean the employees' premiums have not been, what's withheld from their check hasn't gone up, because like, as Mike said, as the overall premium goes up, their percentage of that premium, even though it's staying at 7%, the dollar amount that is withheld from their check does go up minimally each year.
Might be a new item, but the copay, Mike, or other ones, is that still at a $20 or $25 per visit?
The office visit copay? Yeah, that
Yes.
was. And we made a change to that last year at renewal where we adjusted provisions or administrative functions in the back end that basically said no employee can be charged multiple copays in a day. because what we found was happening was someone would go to the doctor, get a copay, have a lab inside of the doctor visit, get another copay, so on and so forth. And so we eliminated that, which saved some employees that were seeing those costs get multiple charged. But yeah, we have maintained the $20, and we still do have the $0 telehealth copay. So someone can call, receive telehealth services, pay a $0 copay for those, which in a COVID year was probably a good idea to utilize.
For an emergency room copay, is that at 100 yet, or did that change, or?
So there's no copay for emergency room. It goes to deductible. So your $300 deductible you would be responsible for. And then once you hit that deductible, the plan pays at 100%.
Okay.
Mike, we could change the deductible to go from 20 to 30.
For
Copay.
yeah. And you know why we introduced that copay a couple years ago as a cost saving measure, which ended up saving a projected about $90,000 at the time. We saw a significant high utilization in office visits for the county. On average, nationally, the average person probably used 3 to 3.5 of those office visit copays a year. There were members with 15 to 20 office visit copays being utilized. And again, they were paying, once they hit their deductible, they were paying nothing. And so we saw a utilization trend increase, and we hoped to mitigate that by introducing some cost sharing. Nationally, most employers have a $20 or $25 office visit, even a $50 specialist copay. That's pretty much par for the course. And so that was the reasoning behind doing that, was to curb the utilization that we saw.
And
Did it
Dubuque
do that,
has-
Mike?
Oh,
Did
go
it do
ahead.
that?
It did. I can't cite the exact numbers, but I do remember the next year at renewal when we came back, we did analysis, and our intent to, the same time where we introduced that copay and that cost sharing, we also introduced that $0 doctor on demand copay in the hope to shift people to that, which on average is going to save the county a good amount of money. I know Sarah and I, through multiple different health insurance committees, talked that up, tried to have educational campaigns on it. And I cannot remember the exact financial savings or the reduced utilization, but I do know that the move saved the county 90 grand. Just because of the copay itself, the $20 that employees have to pay.
And one nice thing about in Dubuque, we're blessed that we've got a lot of urgent care centers. Between Medical Associates and Mercy and Finley, there's quite a few urgent care options too. So the emergency room isn't accessed as much as some areas that don't have as many urgent cares or quick clinics.
Yep. Any other questions on the cost sharing? We good? Cool. So this is just a recap of the plan design considerations that we've discussed, what's been implemented, what has not been implemented. This is trying to historically just kind of show. So again, we discussed changing the base plan from 5,000 to 7,900 2 years ago. That was, we discussed that office visit copay, that was implemented. We discussed having a higher copay for non-preferred prescriptions versus preferred prescriptions. That was not implemented. It was minimal savings. We looked at slight shifts to employee plan design, moving from a $300 deductible to a $350 deductible. That would have saved an estimated 12 grand. That was not implemented. We looked at multiple other funding mechanisms, all of which I'll classify as negative or having a cost associated with them. So we obviously did not implement that. We looked at a working spouse provision, which is the provision that I had kind of described earlier, which basically says if you have a spouse that's eligible for coverage, they are no longer eligible for the plan. So that could save anywhere between $60,000 to $194,000. We did not implement that. We talked at great detail about opt-out strategies. And we pushed these very hard, but because we believe in the spirit of the county and how you offer insurance, these are win-wins for employees. Your employees through the health insurance committee, through feedback, through survey data that we've done, they want opt-out benefits. And there are pretty strong savings opportunities in offering opt-out benefits to your employees. So we see these as a win-win. Conservatively, we believe they can save up to $200,000 if structured appropriately. In an ongoing basis, that number can probably grow. And so we'll spend a decent amount of time talking about opt-outs here in a minute, because again, the same resounding impact from the health insurance committee was they see these as favorable. If the board remembers last year, Cottingham and Butler did a survey. We did a survey to your employees. We got about 167, 168 respondents to the survey. And 1/3 of those respondents, or about 42, said, yes, I'm highly interested in opt-out benefits. And so if you figure that's 1/3 of your population, we could theoretically say between 100 to 120 of your 330 employees would be interested in some sort of an opt-out benefit. And that is to say, I would pay them not to take the county's insurance. That's basically what an opt-out is, right? It allows us to let the employee choose their total compensation. Do you want it in the form of the health insurance? There's a cost to it. If you don't want the health insurance, you can have $150 a month or $200 a month to apply towards your own coverage or your spouse's coverage or Medicare or Medicaid or whatever other coverages are available. We did talk last year too, and Jay and Ann, I think you guys were in these conversations. We talked about the long-term disability benefit and offering something to employees there. That's a coverage right now that is not offered through the county. And that provides income protection in the instance where an employee is disabled long-term. So Cottingham and Butler received quotes for that to cover your employees. And then we talked about life insurance benefit and an enhancement. And candidly, I think both of those talks in late February stalled once March hit and COVID hit and everything hit after that. So those were not implemented.
Hey, Mike, we've only got about 10 minutes left if we're only going to take an hour at a time. So I want you to talk about the opt-out analysis that we talked to the health insurance committee about quite a bit. If that's okay with everyone else, unless there's something else you wanted to talk about.
Yeah, you want to cover this part, Sarah?
Yeah, so Mike has briefly mentioned this today, and I know we've talked about it in the past, but this second option that we would like to offer to employees is going to be, instead of a different health insurance plan, it's going to be an option for them to opt out of buying health insurance, and we'll pay you an opt-out cash bonus, basically, that goes through payroll and it's taxed. We call it an opt-out benefit. So if you choose that you do not want the health insurance and you'd prefer to get money instead, maybe you have great health insurance through your spouse, or like Mike said, somewhere else. Maybe you're Medicare eligible. Maybe you are double covered, both at the county and under your spouse's plan. Everybody has a different situation. Maybe you're already covered under the VA's plan, but you take the county's insurance because it's a low cost plan. Whatever your situation may be, we would offer a second option to opt out. We can also offer this on a tenure-based option. So we can layer the opt-out benefit by tenure. So I'd say we just jump right in there, Mike.
Yep. So what we have to do when we look at this is we take your census data that would include hire date, and we chart it out. And so what you're seeing is your full census data, anywhere from 0 years of tenure, where you have 333 eligible employees and 312 enrolled, which is almost 94% participation. And what you'll see is as tenure increases, the participation rate increases. The longer someone is with the county, the more likely they are to take the county's insurance. And so when I hit 10 years of tenure, 98% of your employees are taking the insurance. There's only 1 or 2 total employees that are opting out of it. When you hit 15 years, again, 98% of employees are taking it. And then up to 18 years, every employee is taking the insurance. And so what this tells us is there's an opportunity to offer an opt-out. And how this chart works is at the top is the opt-out. This one's offered at 0 years. So right when someone would start employment, they don't need any tenure. They can immediately be given an opt-out option. You have 312 employees. 21 of them are already waiving coverage. I would have to pay 21 people who already technically don't take your insurance the opt-out benefit. I can't pick and choose who I get to give that to. Anyone that does not take your insurance has to be paid the opt-out. Now, we think that there's a decent amount of turnover within the first year. So that number is conservatively shown here. But if we offered an opt-out at 0 years and no one took it, you'd have to pay about 54 grand to the people that are already not taking your insurance. Again, I think that number's high because of turnover, because of people coming on, leaving the plan within the first year of employment. But if you were able to get 5 people to take the opt-out, that's where we start to save money. Because if you think about your costs from Wellmark, which are right here, we have about $15,000 to $16,000 in total gross cost. And so even if I pay $200, that doesn't eat up that 16 grand in gross cost. I'm left with a pretty large savings opportunity, right? And so what we try to do is we find a break-even point where what can I offer for the opt-out? How many people do I have to pay? How many people do I need to take it to break even? If we get just 5 people to take it, you start to save money. So that's at 0 years where you already had 21 people not taking the insurance. The bigger slam dunk is when we start to look at the 15 or 10 year marks where only a couple people are opting out. So if I think about it, at 15 years of tenure, you have 114 people. Only 2 of them are not taking the insurance. So I've automatically got to pay them. In this instance, I assigned it as a $400 opt-out a month. So if I offer that up, I'm going to pay 10 grand out in additional cost to them. But then if 5 people take it, the county saves $55,000. If 10 people take it, the county saves $120,000. We had 42 on the survey out of 167 that were interested, which is about 30% of your overall population. So we think these numbers in here are highly conservative. We could see 10, 15, 20 people take the opt-out. These are your net savings. So again, these are people that have access to other coverage, spouses, Medicare, Medicaid, exchange, they have access to other coverage. We can administratively run the opt-out so that they have to prove that they enrolled in the other coverage to be able to qualify for the opt-out. If something ever changed and they lost their coverage or got married or divorced or had a child or any qualifying event, they can jump back on the county's plan. They would lose their opt-out benefit, but they can elect the insurance just like any other employee. And conversely, at any open enrollment period, if someone wanted to drop the county's plan, go on additional coverage and take the opt-out, they could. It would be offered on an annual basis. We can change the tenure. We can do 10 years, 15 years, 20 years. We can change the amounts, $200, $300, $400, $500. You can tweak those as often as you want for whatever amounts that you want to. So this was the analysis in what I'll call kind of the sweet spot of where we think you literally can't lose, where realistically you're going to get a couple people that take the opt-out and save money. And the more people that take it, the larger the savings is going to be. I threw a lot out. I'll pause for questions there.
I will add that this is something that a lot of the folks on the health insurance committee are interested in, and there's a few folks that really would like to offer it as an option. I know Shane Backenstead has talked quite a bit about feeling that it's going to be a nice benefit for some of his people.
Mike and Sarah, this is Jay. What's your experience in the market on who takes this? Is it those that have a spouse? Sorry, I'm getting a lot of feedback here.
Yes, spouses and Medicare tends to be a big one too, because there's 2 components to this. Not only am I going to save the opt-out amount is, right? In this case, it's $400. That's what we showed. But I'm also not going to pay that premium. So if I think about a single's $44, right now a single ends up being $44. So I'm not paying that to the county and I'm getting the opt-out benefit. So that could be $444. A Cadillac Medicare plan with basically almost 100% coverage is about $350 a month for most individuals. So that pays that and then some. And so sometimes that incents people to look at that. Alternative spouses plans Sarah,
Kids under the age of 26 that have options to be covered under their parents instead. Obviously, they wouldn't fit into the 15+ year, but they would be in the 0-year tenure based.
yep. Medicaid is another one where if you have entry-level positions, $10 to $15 an hour people, Medicaid, Hawkeye Care is usually available for those based on income levels. They might still take the county's insurance because it's so cheap and not look at government assistance. We had an odd situation where we were helping a family that works for the county evaluate coverage, and the spouse worked for the state of Iowa and the other employee worked for the county. The state of Iowa has an opt-out benefit that was paying them to not take the insurance. So they took the county's insurance.
As a philosophical matter, I'm not interested in paying our employees to be on the government's insurance like Hawkeye. I don't want to do that. I don't think that that's, I think that's just maybe neglecting our responsibility to provide coverage. If your answer to that is to put your children on the Hawkeye program when we're offering good program benefits, that's part of good government, is to provide a benefit to your employees if they're eligible. I feel differently if it's on the Medicare opportunity where there's the safety net is there, and that's something you can take advantage of. It's designed for that. So I am not opposed to the opt-out concept, and I know I listened to this last year as well, that this was discussed, and I know our employees, I think I even saw it in a budget idea that somebody was already using some opt-out numbers. So I do think our employees are interested in learning this. I don't think I would do it for the people who I would like to see a 10-year number, and I'd like to see it, I guess, done with some care, but it's probably something we should be looking at to do some savings and to also meet an employee request.
Yeah, that's a really good point. And I think you could run this opt-out and say you only qualify if it is employer-sponsored coverage or Medicare, right, or exchange coverage. So you could classify what could be allowed for the opt-out. The other thing that we talked about with the health insurance committee is, look, if there are a heavy percentage of people that are Medicare age that are going to have to now evaluate Medicare, we have to supply them with resources and education. And so Cottingham and Butler, we partner with other companies like Next Level Planning that could come in, help do Medicare meetings, help connect them with Medicare policies, help connect them with almost a concierge type service that can help them shop for coverage, because it's scary and there's a lot of information out there. And so, we would want to layer in education and support and resources for employees to be able to help do that.
I think aside from the opt-out, we're planning on doing a lot of Medicare education anyway. We have found with many of my municipalities and higher education institutions, educating on Medicare is just so valuable. It's a very confusing topic. It's a scary topic, and you don't know what information is accurate. So I've brought, Mike mentioned a company called Next Level Planning. They are a partner of ours, and they will help us educate employees, whether they're 25 years old or 70 years old. You're welcome to join. Maybe you're helping your parents or your aunt or aunt or uncle or someone purchase Medicare and you just want to be educated. You're more than welcome to join us. And then they also have licensed individuals that your employees can give permission for those individuals to contact them directly and help them sign up for Medicare if they are interested. They're strictly told not to sell your employees, but be a educational resource for them and then assist them if necessary.
And you're
So,
saying,
Mike,
Sarah,
if you
that's going to happen, Dawn. That's going to happen. That is happening. It will happen.
We're planning on getting those folks, whether we wait until closer to Medicare open enrollment towards the end of the year, or we can hold those sessions throughout the year as well. Excuse me, sorry. We can hold those sessions throughout the year as well. So we're going to be working with Dawn and the team to get some of those scheduled. And right now, obviously, they're happening via Zoom, which is very handy because then even spouses can join as well if they choose.
And
I
we've had
know-
some of our individual employees reach out to them and go through that process who are nearing that age. We've had several, because they do have to sign off on some forms for you. So we've
Yep.
helped them introduce them to that. But just for budget purposes, Stella, correct me if I'm wrong, you're going to use the number 4.4, which is the $265,000 increase at this point. We can continue to talk about opt-out options, cost sharing with the employees, plan design. We have time to continue to talk about that because our plan renewal is not until July 1st. So as the board, we can continue to have those. Those are only going to be a savings to the county, of course.
The way I've structured the budget at this point is a 5% increase. Because this information here is only the medical plan. We also do have to take into account the dental and vision and things like that. So I've estimated a 5% increase over last year just for budgeting purposes. And like Dawn said, we do have time to continue this discussion, but we do need to include what we estimate in our budget.
And the dental increase, which we got yesterday, is a 2% increase to the overall fully insured premium. We are shopping the vision coverage, which is right now self-funded. Historically, it's ran very well, but Delta Vision is offering pretty significant bundled discounts and 4-year rate locks. And so just for due diligence reasons, we're going to evaluate the vision plan this year and take that to market. So we're in the process of getting a quote right now from Delta Vision.
Would it be, I guess, advantageous to get a hold of all the department heads and just see how many people would be interested in the opt-out, before July 1st, just to have, I guess, some kind of numbers to put together on that, or?
So Mike, do you want to talk about that survey?
Yeah. I don't know.
Mike, do you by chance have that you can pull up, Mike?
Oh.
So Harley, we did a survey last year where I think about 160 employees participated. And about 40 of them said that there would be interest in the opt-out. Now, they didn't say they would for sure take it, but they said that they would be interested in learning about it and potentially taking it. We're gonna have to couple this with some heavy education. So employees understand what they are doing, what they can expect, when they can get on and off the plan again. Because we don't want anyone to not truly understand that they are not going to have health insurance through the county any longer until the next open enrollment or until they would have a life event.
I can see where some people, their wife may have a pretty good plan and maybe they're paying $400 a month for that, where they're not paying anything for ours. But if we're gonna subsidize them, to basically opt out of our insurance, you give them the 400, that's going to cover that. Now they basically have no cost insurance. I could see people jumping onto their spouse's insurance or something like that.
The only other concern I had about this, Mike, and I think you have maybe a slide, or maybe it was an oral presentation, but just that a verbal report. The number that our employees thought they should be compensated at for not taking the insurance was pretty high. I don't know that you would close the deal with many people at $400. I recall them wanting to be paid like $800 to not take our insurance. So there were some outliers thinking that they don't want it to be some kind of the motivation be that they're saving the county money. So they'd rather take that. So there's more to work out, and it's probably not for today. But Supervisor Wickham, you have any questions?
No, I would like to, as Harley mentioned, I'd like to revisit this and go over and have a work session, probably past the budget. But for today, I would be in favor of, continuing the support for the plans as is and the increase that was proposed.
We're more than happy to get back with you at any point to talk in more detail about it. And in addition, if any of you would like to talk in more detail about any parts of the insurance program already offered, you just reach out to us and we can go through this presentation with you one-on-one as well.
thank you very much. It's helpful and you do it in a way that makes sense. So I appreciate that.
Thank you,
Thank you very
Anne.
much,
Thank you,
Sarah.
Thank you
Thanks,
so
Sarah.
much, everybody. I hope you all have a good weekend and stay safe in the snow.
To Sarah. Good to see you, Mike.
You too.
Thank
Hey,
you.
you
Take
too.
care.
Thanks, Sarah.
Bye-bye.
Okay, so next up, we'll start our departmental presentations. So the first department we were going to hear from is our conservation department. So I did see Brian Preston on there. He is. Hello.
Stella, do we need any action on that insurance? That's a pretty big deal, pretty big number. Or do you
Yeah.
want to revisit it later? What would the board like to do?
I think actually, let's go ahead if you want to make some action on that to proceed with the renewal as it was presented, and then we'll continue the discussions on any cost saving measures. But to budget, I'm budgeting a 5% increase.
So what would you think the motion would be to approve a 5% increase for purposes of the budget
I
creation?
think that would be, yeah, I think that would be good.
Okay, does anyone want to make that motion?
I'm comfortable with that. I would make a motion to budget a 5% increase year over year related to our insurance benefits with Cottingham and Butler.
I would second that.
We have a motion and a second. Is there any further discussion? Likely not. All in favor, say aye.
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 Aye, motion carries. Thank you, Supervisor Wickham, for raising
Thank
that.
you.
Is there anything further? We'll move on to Brian.
Alrighty. Do you want me to share my screen, Stella?
Yes, please. See, are you a co-host? Yes, you are. So you should be able to share.
Alrighty. So I just wanted to let you know Nate Sisler, our Deputy Director, is on the line. And we also have Pat Ray, one of our board members, and Supervisor Wickham, who also serves on the Conservation Board here today. So I know, and I've seen Anthony on the call, but one of the few departments that actually hopes for snow is the Conservation Department. So when it snows, we get busier. So we have lots of snowshoers here today, and we've averaged about 15 cars at the Swiss Valley Nature Center all day long today. So a little more snow would be good for cross-country skiing and snowmobiling. So bring her on. So just a little recap of the County Conservation Board. It was created in 1956 by a vote of the citizens of Dubuque County by 84% to create the Conservation Department to maintain, develop, acquire public parks, museums, preserves, and playgrounds. And especially this year in 2020, to promote and preserve the health and general welfare of the people. I know a lot of challenges in 2020, but the parks and natural areas were really heavily visited, and we'll get to that a little bit more down the road here. But in 1989, the Chapter 350 was changed, and it requires every county to now have a county conservation board. And today we manage 21 areas, over 2,800 acres with 8 campgrounds, and of course the Heritage Trail, which is now 30 miles long, and lots of Mississippi River accesses. So this is kind of a current map of our areas, and you see the ones in tan are spread out pretty good across the county. And a listing of all the different areas that we manage. So I just want to give a shout out to our staff this year. We are up to full staff. Finally, we added Megan Willenbrain on as a naturalist here at the Swiss Valley Nature Center. Right around when COVID hit back in March, we were just starting the application process for the naturalist position, and with the uncertainty, I held off there for a little bit, but now we're up to full staff, have Megan on board. But our staff did a tremendous job throughout the COVID and still remain doing that. We worked continuously through the pandemic, and we received really heavy usage, which was really great to see. We have our board members, Pat Ray, Cindy Gatto, Jay Wickham, Stacy Conforti, and our newest, George Davis. So he just was at his first board meeting a couple weeks ago. And some of the unsung heroes are our conservation aides. And and Nate, if I'm wrong, call me out here, but I think we probably had the finest conservation aid crew that we've ever had. This is just a few of them. We weren't able to get pictures of all of our conservation aides this year, but Ethan Lawson, Carson Bellis, and Addie was our naturalist in AmeriCorps naturalist up here at the Nature Center. We try to get them out and do as many educational things as we can. They do a lot of the heavy lifting throughout the summer with cleaning bathrooms and picking up garbage and mowing grass and weed whipping. So we try to get as much educational component as we can in there, and they did a fantastic job. We also had the trail crew, which 4 high school age kids, and Tom Kuvalier, who is our trail crew leader last year. They did a phenomenal job of maintaining our trails. We received more compliments this year about our trails being in great shape, and it was large part due to their efforts. And also the Iowa Workforce Crew. This is a partnership between the local high schools and the Iowa Workforce Development, and they provide some supervision and go out and do trail work and all kinds of maintenance throughout our parks. So it's a great benefit to both. One of the exciting things that happened this past year was the adoption of our Dubuque County Conservation Comprehensive Parks, Trails, and Open Spaces Master Plan. And it lays out a vision for the next 20 years and a vision of a network of high quality parks, habitats, trails, and water supported by communities passionate about nature. Our mission to engage the community stewardship and enjoyment of its natural resources, and our guiding principles that we have parks that are built to last, are community science and education driven. It's an equitable system that all residents and visitors, regardless of their physical and social status, have access to our areas. And it's a collaborative effort between Dubuque County partners and a caring and engaged and educated public. So we adopted this back in November, I believe. It was a little rough towards the end of it. We had hoped to have in-person public input on the final plan. We had to do so on the internet and take our public comment that way because we weren't allowed to meet in person, but we got a lot of feedback, and people are really excited about our long-range vision. A couple of things I just want to point out about what we found out as part of this is that, people who are seriously considered moving to Iowa, the landscape is their #1 reason affecting their decision. And here in Dubuque County, we're blessed with some really dramatic landscapes and beautiful landscape. And that's kind of called out in our new logo and branding effort. Newcomers value their recreation. That 64% of new residents attribute recreational opportunities as being one of the key factors in influencing their decision. And in Dubuque, parks, trails, and hiking and biking are the #1 factor people like most about the Dubuque region. And interestingly enough, that's the #1 thing they want more of. Some really unique points that came out too, which I really didn't realize until we dove deeper into this, is that our campground visitors, almost 70% of them came from outside the county to visit our areas. 30% roughly were from within the county. That's pretty huge difference in where people are coming to visit us from. And then the Heritage Trail, that 80% of the users are local on the Heritage Trail, and 20% are coming from outside of our area to utilize the trail. And one of the statistics I found shocking is that the average person that uses the trail uses it 86 times a year, which is pretty staggering. That's more than once a week. Those folks are out there visiting the Heritage Trail. I mentioned our branding. Our old logo is on the left there, and our new one is on the right. And we just started our new branding effort. Here is our new patch that we just received that will be getting placed on uniforms and clothing. We've started putting the new stickers on our vehicles, and are just getting started with the branding outreach. And we've had a lot of positive feedback. I just did a program with the Rotary the other day, and they really like our new logo. This is a telling statistic here on the use of some of our areas. We don't have enough counters to cover every area that we have, but where the counters were out, we received more visitation in 2020 than we did in previous years. Finley's Landing had about a 50% increase in use. Proving Grounds, about 3 times the use. Swiss Valley had about a 62% increase, and Whitewater Canyon had a 200% increase. So pretty stunning, pretty telling how important these public areas are, especially during the pandemic. We expect to see these trends continue, at least for the next couple of years. This is a photo here of Swiss Valley Nature Center. This is back in March. We had some really heavy use days. It created a lot of concerns for us during the pandemic that we had some of our rangers out patrolling and trying to make sure that people were socially distancing. As things went on and we learned, we started to limit parking access to areas to control the numbers of people in. And one of the interesting things enough is we didn't have our counters out until May. So all these cars don't add into our total of visitation for 2020. Heritage Trail had a really doubled the number of use. And this is one counter we had at Rough Hollow Road, just kind of give you an indication of the much heavier use we had this year. Nearly 100,000 more people visited visits to the Heritage Trail at Rough Hollow Road there at Heritage Pond. A really huge increase. So it was a challenge for our staff. We spent much more time cleaning restrooms, picking up garbage. We did incur some more expenses in having trash picked up more often. So with that increased usership, it did create a lot more strain on the staff, but they did a tremendous job of dealing with that. Kind of keeping in line with the increased usership, our current fiscal year, FY21, we're nearly to our budgeted amount of $260,000 for revenue for the year. And this is only half the season. So we expect to go right past that number, and we're excited about that. Just kind of a breakup of the economic impact. You know, this is from last year's data, so this is probably a little more, little higher than actually is in here, you know, but it's tough because we didn't have as many people coming from out of town to use our areas. Most of our visitors to the parks were local. So it's still a pretty conservative impact of our areas. Our environmental education program, which in our long range plan, we had a lot of feedback on how important our environmental education is to the community. This is at the bottom here, you'll just see one of the 5th grade teachers from Irving, a little comment they made about how important these trips are. It's not just an educational thing, but getting them, many of these students haven't been to our park before, getting them out here, exposing them to these areas, and then in the future, they bring their families out and drag them with them. You can see our program numbers in March, April, and May really tanked out. We were struggling to figure out how we were going to deal with COVID. Once we figured that out, we picked that back up. Volunteer is of huge importance, and it's kind of spearheaded by our environmental education program. They schedule our volunteers and schedule with the park rangers what things need to be done in the parks. We had over 1,000 hours of volunteering in our parks this summer, which is a huge help to our staff. And you can see that trail and habitat work number is really high. And I think that's another reason why we got so many compliments this year that our trails are in such great shape. We have been working with other volunteers, a restoration club event. They've been meeting on a monthly basis to go out and tackle some of our invasive species problems and brush growing out in areas, and doing some real conservation science by monitoring our bluebird boxes and tagging butterflies and monitoring water quality. So it's been a huge help. Without those many hands a lot of our areas wouldn't be able to have the diverse flora and fauna that we have. The one picture on the right there is of Pullman Prairie Preserve, and you can see how rapidly the vegetation encroaches on that prairie. We have many, many very conservative species up there. I didn't include a picture of it, but there's pasque flowers that bloom there, which are very rare. And we want to continue to have those biological reserves to have that diversity. And our environmental education goals, one of our goals, and this is in our long range plan as part of it, is to implement a school-wide K through 5th outdoor adventures program. That way we would provide equitable experiences among all students throughout the school district for environmental education. A lot of other things going on. Our naturalists, especially during COVID, worked really hard to get some additional mapping and brochures out that people could become familiar with all our trails. They worked on many interpretive signages that went up this summer. So that time that we weren't spending with the students from the schools was spent really well doing some other things that have kind of fallen through the cracks over the years. As part of our rebranding effort, we used to have a Swiss Valley Nature Center Facebook page that has now changed to a Dubuque County Conservation Facebook page with almost 5,600 followers at this point. We still do have the Heritage Trail Facebook page, but it really has been a wonderful way for us to reach out and get some exciting information and projects we've been working out to people. One of the things that's not captured in our volunteer totals are our Eagle Scout projects. And each one of these projects had numerous hours that could be attributed to the volunteer total. And I just realized that we did not include that. So that's something we'll work on, getting those hours included in those volunteer totals. But some great projects, over 1,500 tires recycled out of Bowstring Wildlife Area. Some new steps down at New Line Park, a redo of the pavilion at Dyersville, the trailhead there, a new roof, and the entire structure was painted. Numerous bathhouses and barn owl boxes and wood duck boxes put up at various areas, as well as the outdoor amphitheater here at the Swiss Valley Nature Center was improved by some of the scouts. So kind of getting to our budget for this upcoming year, revenue will basically be the same. We did increase recreational fees by about $10,000, but the revenue will basically be pretty close to the same as last year. We're projecting the operational expenses without personnel costs or step increases included in that would be about a $600 increase. Most of that increase is due to the refuse removal. We had to adjust some of those estimates up for the upcoming year because we still anticipate high usage. And we did take some of the educational funding down because some of the training and things that we do, we expect to be virtual here for the foreseeable future yet. Some of the projects that we've accomplished over the past year are the Bridge 21 project. That was a large bridge out by Gun Club Road that was replaced. It had previously had 15 piers under it, now it has one. Really huge improvement for drainage and for the users on the trail. Bridge 17, we had a little unexpected failure in the bridge. You can see the middle pier there sat down on us. So instead of, I worked with Anthony Bargett to figure out a fix for this, and we figured out, he did some flow calculations for us, and we figured out we could solve this problem with some culverts rather than having a bridge. Bridge 2 has been completed. That finished up in December. It drug on a little bit. We expected it to be completed by Thanksgiving, but due to some supply issues with some of the materials, it took us a little bit longer to get those materials in, but it is complete and being used now, and it's a huge improvement to the Heritage Trail. We did every year for the past probably 10 years, we've been maintaining the trail service to a much higher standard than we have in the past. We do about 6 miles of resurfacing every year. We use the live bottom trucks to put the limestone down, and then we spread it with our skid steer. So it works out really well. We do that in the fall, and by spring it sets up so it's a good surface. We did get some of our latrines installed this year. One along the Heritage Trail at Twin Springs, which is pretty important because that's one of the locations that people identified for camping along the Heritage Trail. So this spring we'll be installing some camping platforms. They're wooden deck-like structures that people can set their tents up. They will actually be able to camp along the Heritage Trail. And this restroom is an important part of making that happen because we need to have facilities nearby that people can use. We also installed one at Fillmore Recreation Area near the campgrounds at the same day. Interstate Power Preserve received such heavy use that we've actually never had to do this before, but the trails were so heavily used that they were just down to mud. So Nate and the staff went out and reseeded those areas and rolled out some straw matting to actually protect the new seeding and encourage it. Now it is nice and green and in a lot better shape. Proving grounds, another one of those areas that we've seen huge increases of people. The mountain bike trails are completed. Pathfinder LLC out of Minneapolis completed that construction. And we did some additional work out there. Our volunteers made signs and named the various trails out there and installed them. We also have some scenic overlooks now with some interpretive signage that kind of tell the history of the area and the uniqueness of the proving grounds. At Bowstring Wildlife Area, over the last 2 years, we planted over 5,000 tree seedlings, and we are managing for large blocks of habitat. And so the species of greatest conservation need are those that need the largest block of woodland, timber, or open grassland. So we filled in some of those open fields with young trees to help provide additional habitat. John Deere Marsh, we completed the dredging project, which was a major challenge. Took much longer than it should have. We had a lot of permitting issues with the Corps of Engineers, the Fish and Wildlife Service. We were able to overcome those and get that dredging complete. It immediately started seeing boat usage from the boat ramp there, and we did repair the trails out there that were heavily damaged by flooding and the construction. The Fish and Wildlife Service helped pay half of the rock for those trails out there too. At Mud Lake, we finished the dredging from the boat ramp and marina out to the main channel, and we installed a new courtesy dock at the boat ramp, which is much appreciated by the public. Heard lots of great comments on that. The Miller McGrath Wildlife Area, we completed the pond right before the 4th of July, at the end of June. And our crews went out there and did all the underwater work before it filled up. We did all kinds of structures that for catfish and for underwater protection for the bluegills that were stocked in there. It was stocked with bluegills late in the fall. It did not fill up completely until early December. I think as soon as we completed the construction, the faucet turned off in the rain. But I received almost every day, I received calls from people wanting more pond fishing access. And I talked to a gentleman earlier today. I told him about the Miller McGrath Pond and the Ringneck Ridge Pond. And he's like, you guys need to do more of those pond projects. So we will do our best to keep those projects going. The Miller McGrath area, we also pulled back and stabilized over 2,000 feet of stream bank and seeded native grasses to over 20 acres. And those stream banks were armored just at the toe with riprap, sloped back, and they were planted with native prairie too. And that will greatly reduce the amount of sediment going down the Lumakokota and into the Mississippi River. Finley's Landing, we did some dredging from the boat ramp out to the main channel, and we also replaced the courtesy dock up there. Those were both very popular, but probably the most popular thing we did at Finley's Landing and almost any park. We've received a lot of really positive feedback as we finally replaced the footbridge that went across Basswood Creek there. And we had a night hike, which is, we've been trying to invent new ways to have public engagement during COVID. We set up a night hike. The naturalists and volunteers lit the trail and lit the bridge, and we had 300 people that came out there. So we had set times to separate everybody, that they would sign up for the hike and show up. And we've been doing a number of these that have been very, very popular. We continue to do great things in our natural resource management. This is a prairie fire, out at our prescribed fire out at Miller McGrath Wildlife Area. You can see the tree encroachment. With the wetter climate that we've been in, we've had a lot of problems with trees growing out into our prairies. That prescribed fire is our most efficient way to get out there and set those trees back. We did stock ringneck ridge with red-eared sunfish, and I had to put a gratuitous picture of my daughter. It was during COVID, but we picked up the fish with my truck and we took them out and carried them back to the pond, and she had a great ball. He wasn't in school, but she loved that. And then this is one of our food plots at Whitewater Canyon. You can see the sunflowers there. We're mowing them down, shredding those seed heads so that the birds can get down to the seed easier. And you can see in the background some of that corn food plot. We're still seeing large numbers of pheasants down at Whitewater Canyon. And we're really excited to see increases in our pheasant population over the last couple of years. Some of our habitat projects, we were fortunate enough to receive a large donation from Morrison Brothers Tree Farm from about nearly 1,500 landscape-sized trees. We did send, because of the derecho, we did send our crews down to Lynn County, Jones County, and Cedar County to help with some emergency response. And it was really appreciated and really well received. As part of that, we had too many trees that we couldn't plant all in our areas. So we reached out to those counties impacted by the derecho and gave them some trees to help start replanting in their parks. This is, and you can see our guys on the tree planter planting trees down a bowstring, and that's what they look like after a few months of being in the ground. It's very exciting. We're planting oaks, hickory, and a few other trees, but predominantly oak, because oak hickory forests we're losing at the rate of, in the state of Iowa, about 4,000 to 5,000 acres a year. One of the things we're really concerned about are invasive species, and you can see on the far right, that's a picture of some Oriental bittersweet out at the Proving Grounds Recreation Area. We have had staff, our natural resource technician, working on going out and cutting vines and treating them. We need to really step up our efforts to control these. I'll show you a picture a little bit later that's really alarming, but to me, probably Oriental bittersweet is probably the biggest threat to our natural resources right now. At Balltown Overlook, we did install 3 interpretive signs to help improve the educational component up there. We're also going to be adding a selfie stand that's going to go in the spring up at Balltown Overlook, and that'll be promoted through Travel Iowa. People will be able to post those pictures. So we think that's another part of our ways to effort to start marketing our parks in the Dubuque County area. The Swiss Valley Nature Center, we completed the prairie exhibit, and it's pretty neat. Not a lot of people have got to see it yet because we haven't had a lot of people inside the building since they're outside of COVID, but it is a really cool display. And we have opened up the Nature Center. We are limiting the number of people in here. They have to be masked, and we have extra cleaning precautions, but so far so good. Things are going well. But one of the things that is really telling is you can see those 2 long tubes in front of the display. Those are actual Indian grass and big blue stem root systems. And you can see how important those prairies are and how deep they go and how important they are for building our soil, for keeping water from running off into our streams and taking our topsoil with it. So really good illustration of how important prairie is to our ecosystem. So we'll get into our request for FY21. And the first thing is a new patrol vehicle, North Patrol vehicle replacement for $30,000. The current truck has over 100,000 miles on it, and is starting to receive quite a few repairs. A UTV replacement, this one for $17,000. And one of the things I want to mention is that we received a lot of upgrades in our equipment the last few years that were really needed. We just ordered a new tractor, another mower, and we just got a UTV. So we are going to be in really good shape for equipment for the next few years at least, with a few trucks and odds and ends. But we really have done well at keeping our equipment updated and in good shape. Our Fillmore rough mower replacement for $30,000. The current rough mower was purchased back in, I think, 2007, 2006 or 2007. It has 30,000 hours on it, and it is really used up. We haven't done much for equipment upgrades at Fillmore over the last couple of years, and this is a really important one. We would like to add a dump trailer. This would be a very versatile tool for us. A lot of times our other trailers are filled up with mowers. This one, a dump trailer such as this, we'd able to be able to put our skid steer in it, transport it that way. Also haul materials like wood chips and things to playgrounds that we're working on, which would be a very handy tool. Out front mower replacement. This would replace the Kubota F3080 for $28,000. This mower currently has about 2,600 hours on it, and by the time we get it replaced, it's going to have well over 3,000. The Fillmore Greens mower replacement for $32,000. This machine has well over 3,000 hours on it currently, and we did buy this as a used piece of equipment several years ago. Fire ring replacement. We still have a number of fire rings to replace. This would replace or get us completely up to date at Massey Marina. And we also are in the need of more picnic tables. Most of the picnic tables we have at Massey are extremely old and in dire need of replacement. Fillmore Rec Area, Fillmore Clubhouse needs a new heating and air conditioning system for $12,000. Finley's Landing, we're proposing to replace a current open set of slips with a set of covered slips for $28,000. The new set of slips would have 6 or 7 stalls and would pay for itself in approximately 5 years. Upper Harbor at Massey is extremely low. It has not been dredged for, I think the last time we dredged down there was 2006, maybe 2007. So almost 13 or 14 years. It is very shallow, and people were actually, their boats, when the water dropped, were sitting on the bottom in our harbor. Bowstring Wildlife Area, once again, we get back to managing for large blocks of habitat. The 3 fields that you see that are not marked within the green boundary are in cool season grasses. Right now, mostly brome, and we would like to upgrade them to a pollinator mix of prairie, and it would benefit not only those pollinators, but also the bobolinks and savanna sparrows and other things that we've seen down at Bowstring Wildlife Area. We'd like to continue the upgrades on the fencing on the Heritage Trail. We're responsible for 52 miles of fence, 26 miles on each side of the trail. And we'd like to continue that with $15,500 for fence replacement. The Interstate Power Forest Preserve, our parking lot is tiny up there. We are in the process of acquiring an additional acre to expand the parking lot from ITC. And we would like to expand that parking area so that we keep people off the road. I know Old Davenport Road is seeing a lot more traffic out there because of the Southwest Arterial, and we want to make traffic as good as we can. Behind Flex Steel, along the paved section of Heritage Trail, our trail runs along the top of the dike, and on the stream side of the dike, we have some extreme erosion there. We've already had to repair a site upstream, and now just downstream, we have the bank eroding and threatening the trail. We're starting to see a little bit of calving. The asphalt surfacing is starting to dip towards that size, and we need to get that stabilized and repaired. Heritage Trail Bridge number 1, and I'm happy to say that I hope this is the last bridge I ever replace in my career in the Conservation Department. But this is the first bridge right off the highway, or Rough Hollow Road. It is, if you take a look at it, it had burned prior. I think that was probably back in the early 1980s that it burned. It burned off all the creosote to it, and it currently has a weight restriction on it and needs to be replaced. We're looking at some hydraulic analysis. We do believe, hope that this could be replaced with a pre-stressed concrete box culvert instead of a bridge, which would reduce that $150,000 ask. But we are doing hydraulic analysis to make sure this $150,000 total would replace it with the existing span. But there is not a lot of flow that goes underneath there. There's a box culvert to the side that actually restricts the flow to that bridge. So we think we can get by with a box culvert instead of a bridge structure. A fish habitat grant improvement. We've already been granted, awarded a grant for this project by the Fish Habitat Program for $24,957, which is 90% of the cost of this project. This project is right downstream from the Nature Center. We have some straight up and down banks, highly eroding, very poor habitat for trout. Trout do not like wide, muddy bottom streams. It covers up the benthic macroinvertebrates, and they don't have any food. So this would stabilize those stream banks and create some quality fishing opportunity. And again, 90% of this project cost is covered by a fish habitat grant. Our Swiss Valley Nature Center is part of our long range plan. You see in the picture of the parking problems that we have at Swiss Valley. We have a very limited parking area due to the terrain. Part of this project would alleviate that parking issue. It would relocate our entrance road to the rear of the Nature Center. That front part, which is currently some parking area, is very dangerous. That's where kids coming in and out of our Nature Center in between vehicles and heavy traffic. This project would be for $80,000 to start the design process for these improvements. And these are some of the big items on our comprehensive plan. This total project cost would be around $6 million, but this would be the initial design and engineering phase, which would give us those documents to go out and reach out to private partners and grant opportunities and funding sources so that we can make this project a reality in the future. The land acquisition fund, we're requesting $100,000 towards that. In our comprehensive plan, we are targeting areas that are already existing. We have areas such as Whitewater Canyon, Swiss Valley Nature Preserve, Bankston Park, and Whitewater or White Pine Hollow that are targeted for land acquisitions, along with the Little Maquoketa River Greenbelt. So these funds would help us leverage other dollars through grants and donations to protect those areas, and very important. And a lot of those areas, are getting gobbled up rapidly. We have a $10,000 request for the Conservation Corps of Minnesota and Iowa. And this is a unique one. We've never participated in anything like this before, but this would allow us, $10,000 would give us 2 weeks of work with this crew. They're part of AmeriCorps. we would request them for the late summer timeframe to come down and help us battle invasive species, do habitat improvements such as timber stand improvement, and other things. But this is a picture of Oriental bittersweet. And you can see how devastating that is. It actually pulls down mature trees. It actually blankets and smothers out everything underneath of it. The only way to battle this invasive is to cut and treat the vines. I'm battling this at home. We have a lot of it, and one tree can have 60 vines coming up out of it. So very labor intensive. This would give us a crew for 2 weeks that would help us get a head start and allow our staff to get ahead of these problems. To take care, it's a collaborative project between the Mississippi River Museum and the Dubuque County Conservation Board. We're requesting $40,000 again for this partnership. This last year, we weren't able to initiate the full program. Originally, when this was proposed, it was a 3-year, $60,000 project each year. Last year, it was funded to $60,000. There are still $15,600 remaining. We'd ask that be carried forward into FY22 and an additional $24,400 for this program. And primarily, it's aimed at getting teenage kids, one of those demographics that we have a tough time getting involved in our environmental education program, getting them out to advocate for our areas, to engaging them by doing meaningful work on our areas. One of the projects that the River Museum is working on right now is purchasing a greenhouse, which they will raise pollinator species, prairie species, and to be planted in our public parks, our county areas throughout the county to benefit those pollinators. So it's a unique opportunity and one of those partnerships that we really value. Another improvement request for the stream rehabilitation and stabilization at Swiss Valley Park. It's a $550,000 project, and it is a really important project that is in our comprehensive plan that really scored well. One of the problems at Swiss Valley Park is everybody wants to play in the stream. The easiest place for them to do that right now is in the stream crossing, the roadway. As part of this project, we intend to make a stream play area downstream from the creek crossing to keep children and people from playing in the road, basically. If you've ever been up to Swiss Valley Park, it can get very difficult to drive through in a busy day, and it is really unsafe. That crossing is very slippery, and if somebody falls, luckily we've never had an accident, but it is certainly a potential. Our stream banks along in the park are straight up and down. Really took a beating in that flood in 2011 when we had the 16-inch rain overnight. The Catfish Creek, or the Eric Schmeckel and the Catfish Creek Watershed Coalition group have $250,000 available for this project, so we'll be asking for an additional $300,000 to carry out this project. Like I said, it's very important, not only for getting people involved in water, actually develop an appreciation for it by being in it, but also protecting that soil from being washed into the creek, upgrading the habitat along the stream and the park. We've done a lot of work in the Swiss Valley Nature Preserve, piecemeal, little piece by little piece, little fish habitat project by another fish habitat project, and we're nearly complete at the Swiss Valley Nature Preserve with improving the stream banks and restoring them, but we have a really large need at Swiss Valley Park. And this is kind of a rendering of what that would look like. A much more natural stream. If you look just down from our creek crossing, we have a bank, a highly eroding bank that's over 20 feet tall, that's having large amounts of sediment into the stream every year. Another improvement request is scored very, very high on our comprehensive plan by the people that were commenting on it, and that is to make some improvements at the Durango access to the Heritage Trail. And part of this project, with $128,000, we would improve the canoe and kayak launch at the bottom, but we'd also be doing a lot of stream bank stabilization and improvement of that area to keep, that area has been flooded numerous times. It would improve the stability of that bank straight up and down right at the edge of our parking lot. So very important project, scored really high through our public input process, and we'd like to move forward with that. And our final improvement request for this year is a full-time naturalist, which would cost $64,358, including benefits for the first year. But a lot of our feedback from our long-range plan is that they wanted more, the public wants more environmental education, that it's so important that we develop that appreciation for our outdoors and natural resources at that young age. If we want those folks to go on and want to protect and preserve our environment in the future, we need to impact them when they're younger. And it really lines up well with our vision and mission, a world-class outdoor education that engages and exposes all Dubuque's elementary students to the outdoors. And to create community of stewardship through an impactful outdoor learning experience, peak kindergarten through 5th grade. So this would impact, we would be able to bring all students in the Dubuque Community School District either out to a park or go to them in their schools and engage them with environmental education. I think in the summer, they would also be doing summer camps and public programs to get the public out and appreciating our areas. So with that, I'm pretty much done. And if anybody has any questions, I'd entertain.
Brian, great presentation. I appreciate it very much. And I appreciate that you tied it repeatedly to the comprehensive plan. I got the comprehensive plan open here and I can't see the direct correlation. Not everything is, I can't see it necessarily on page 216 or something. But I know I've been listening to some of your board meetings, and I know that that conversation's come up at your board, and Supervisor Wickham can address this too, that it circles back to what was the highest need in the plan. So, that stays top of mind for me, that plan's been completed, and we want to be sure that the jobs and the work that we're doing and the money we're spending is, after we get over equipment issues, to be really looking at the balance of the needs that were set in kind of a timeline by RDG.
And so part of the the equipment needs and the improvements in our areas really ties back to, we still want to provide a high quality parks, and to do that we need to maintain what we have. Some of these larger asks are for things directly out of our highest scoring projects in the comprehensive plan. And, like the Nature Center project, that engineering is going to lay the the framework for us to go out and raise the money necessary to do that. I know Dubuque County is not going to be able to fund a $6 million improvement to the Swiss Valley Nature Center. But this funding will give us the ability to have those documents so we can go out to those private donors, those other partners, and raise that money to get that project completed.
Right. Well, we're on the issue of that. I want to just, I guess, kind of stretch a little bit about, there's not a request here for, you're asking for a new naturalist, and you and I have talked about that, but there's not a request here to do some kind of contract hire for a director, a grants director, or someone who would be looking at, I think the vision is there, that the comprehensive plan's pretty persuasive, but there's no one to write philanthropic grants to private foundations. So I guess, you know, and you and I have talked about that, and you knew this was going to be kind of a topic we were going to address briefly today, but I'd like to see an opportunity with the supervisors to schedule a work session with your board just to talk about the lift that's needed to get this comprehensive plan off. So how do we get ready to write grants to family foundations and to people that in the community who grew up here, that fundraising component. So I am supportive of nearly everything you've put forward here, but I don't want to go another year down the road, have this conversation, have it be, well, you know, we're just finishing off that last something. So
Yeah.
how are we going to do that?
I think we're really good at going out and applying for existing funding sources, whether they be through fish habitat, wildlife habitat, REAP. I would like to create a committee to go out and that's something I don't have much experience with, is going to private foundations or philanthropic givers, to try to find those large dollars required to complete projects of these magnitudes. And these projects are going to have huge impacts to our community when we complete them. So I think developing a committee with the Board of Supervisors and our Conservation Board and some of our staff, and fleshing out some of those ideas of partners, who is good at fundraising, who is good at grant writing. I know ECIA just did a grant for us that we received. We scored #1, and we received a Water Trails Planning grant. So that'll be starting here. I just got a call yesterday, I think, from the Water Trails section of the DNR wanting to get that project underway. So that'll also leverage us to go to partners for supervisor. So yeah, I would really like to put together a committee of people willing to work with us, give us advice, and maybe get us some additional resources to go after these partnerships and opportunities.
Brian, on that full-time naturalist, I had talked to you a little on that. In the school district, were they going to kick in some for that if we got that position, or?
So we're working on a memorandum of understanding with the school district. We have not got that complete yet. That's why I didn't present it, but there's potential there for funding for that naturalist position. Yes.
Okay.
Hopefully we'll wrap that up here shortly and be able to get that agreement. I've been kicking back insurance and requirements and things with the school district, and we're getting very close to finalizing that memorandum of understanding.
Okay.
And Stella, are you obviously that's another personnel, another employee adding. So that'll be, I guess I'm not necessarily willing to move on this today on the new employment. I mean, we've got the sheriff requesting several new people. We just added someone to facilities. The naturalist, it sounds like we kind of need a couple other pieces to fit in to get this accomplished as well. So
Yeah, Supervisor McDonough, I would generally agree. I like the naturalist position. I heard the same thing that Supervisor Potoff did, that the school district is a good opportunity. And I think that partnership sounded really good when it was presented. So I would encourage both the Conservation Board and the Board of Supervisors to lean forward and see if we can get that solidified. And that's the point that I would be very interested in adding the naturalists.
if we don't get that partnership together, I mean, the state legislature has been pretty active with creating difficulties for school board budgets this year with what they're doing. So if that doesn't happen, is our intent to put this person on July 1 regardless of whether that's a partnership?
I'd
guess
like to have
Brian,
a discussion.
yeah, yeah. So is this that time for that, or are we going to pencil it in and then come back before the job goes out?
Yeah,
I would, go ahead, Jay, sorry, or Brian.
that's me, sorry. No, I think we're pretty close to being at an agreement with the school district. Yeah, I would recommend that we need to get it in the budget and present it to you, but I think there's some opportunity there to make it a little more palatable for the county and the taxpayers. Developing that partnership. And this would be a unique partnership. This would be the first one in the state of its kind. But without that additional naturalist, we won't be able to serve all the kids. We just don't have enough bodies.
That's kind of what I was getting at, that if that doesn't go through with the school district, well, and that's where the bulk of this person's or this position would be spent, as in an operation, outdoor adventure, whatever it was called. I can't remember, sorry.
Yeah, outdoor adventures.
Yeah, I'd definitely be interested in it as long as we can move forward with the city, or with the school district, sorry.
So for you, Supervisor Potoff, is it contingent that there has to be another funder for this?
I guess my take was that the majority of the workload for this naturalist was going to be with that school district position for the kids. I guess if that's where the bulk of the workload's going to be at, is with this outdoor adventure. I guess where do we stand if that doesn't fly, Brian? I mean, you that short staffed, or?
Yeah, the addition to the outdoor adventure program would max us out, and without that additional person, we wouldn't be able to move forward. We always have that need for additional programming. I mean, whether the school district moves forward or not, we'll still be able to keep an additional naturalist busy. We can schedule more school groups. We can do more public programming. One of the things that we did not get included in our budget presentation is we have the Mowers to Monarch program this year. And I hesitate to even bring it up because we didn't talk about it at our conservation board meeting, but we had $32,000 for Mowers to Monarch last year. And it has been very successful. We really just started kicking it off and taking the applications, and we have a waiting list of people that would like to participate in. So I'd like to go back to the conservation board and see if they'd be willing to ask for additional funds for the Mowers to Monarch program. I think it's really important work, and it's been really well received by the public.
I'm not opposed to the naturalist position. I think I listened in on a meeting where that was discussed too, and that you had some individuals from the community school district present. And I always find it noteworthy that Brian, you yourself went to Fulton School or Audubon, where they don't have windows. Audubon School really doesn't have windows in every classroom, certainly. And yet you're our conservation director who doesn't like to ever be inside, which I think might be a direct correlation. So I think that's something to keep top of mind.
And one of the things too is this may sound a little sappy, but one of the most vivid memories I have of my school elementary education was going to Swiss Valley on field trips. We went out a couple times a year, fall, winter, and spring, to see the changes in the seasons. And I still remember Bob Walton standing by the fireplace and talking to us and taking us out on trips. So I think it leaves a huge impact on the students, and it's not just a fun trip. We teach a lot of great information, and our field trips are designed to align with their curriculum and their requirements.
Okay. I don't have anything further unless you do, Ann, or?
I have a list of all of the projects if you want me to put that up, if you want to take any action today on any of those, if that will
The only other one I wanted just to make note of, I know that I signed a claim recently for the Take Care program, the Conservation Board. I think, Brian, you were explaining to me, you swapped out
Yep,
some
so
funds.
3 year proposal, and some of the things fell through for this year because of COVID, so they switched up the greenhouse to this year. So a little switcheroo on the projects they're going to carry out, but hopefully with the vaccinations and things, we're able to get back and engage more of those high school kids and get them out into our areas and doing projects.
Right. Okay, so Stella, do you have like a running total for us, or how do you have it up on a document? You're muted right now.
Sorry. I'm working to share my screen here quickly.
Sure.
Should I unshare?
Can everybody see my screen with the list of projects?
Yes.
Okay.
Very small.
And then remind me of what the current number is that they have in fiscal 21.
In 21, we budgeted 1.14 million.
Okay. I guess I would ask if there's anything on this list that we have specific concerns about approving or want to, I'm just going to throw something out there, which is the parking lot to IPC. I do think that there might be neighbors not real excited about that. Have you worked that up at all in terms of it's $75,000 for 1 acre?
So
You know,
the acquisition of that land is separate from that. The $75,000 is just for the parking lot improvements.
right, but you're going to put a parking lot where there isn't one.
Yep, I
That's
have
the
not-
land. I think the land cost was a lot less. Is that right, Brian?
Mhm.
10,000.
10, 15?
10,000.
Yeah. That would probably merit some discussion, that improvements to that park were, not taken as well by the neighbors as we had hoped. And I don't know if there's, certainly we've had some discussion on this. We'd have more discussion if needed, and we could even invite the public in to share their thoughts and ideas. But that was one that did have some additional discussion. And the other one that I would like the supervisors to discuss as well is the design for Swiss Valley. That's $80,000. And so that was one we went back and forth on, and it'd be good to have a little dialogue at the supervisor level on that item as well.
And just one thing I want to point out too, the total price tag for those projects would be reduced because we have $250,000 of revenue that would have to be put in for the stream rehab at Swiss Valley.
Right.
And then the fish habitat project would also be 10% of that total. So it'd be $2,773. So 24,957 would be revenue that we'd have to budget for too.
So these are overall, the whole package is a more modest improvement if you look at year over year. And I know you have equipment things that as you expressed, we have to get some of these done so that they're behind us. Every year I keep wondering how many more pieces of equipment do you have to have? And turns out you needed a bunch. So
We do have a lot of equipment and it's all important, but we're getting a lot of the stuff has been updated. So and Nate, you can chime in, but I don't think we're going to have nearly as many requests for equipment over the next few years.
right. Well, how do you want to do this? Do you want to take bites at it and look at the, I would be happy to make a motion, for instance, for the stream rehabilitation and stabilization at Swiss Valley Park. I think we should fund that. So my motion would be to approve the $550,000 addition to the budget.
That'd be just 300,000 though, right? Isn't soil and water putting 250 towards that? Okay.
Yep.
So the way we
how-
budget, Harley, just so you know, is that for something like this, we'll budget the entire expense because we'll expend it before we get a reimbursement. So the entire 550 would go into the expenditure line, and then we'll include a revenue. So we don't net them.
Right?
Oh, okay, I'm sorry.
And
Yeah.
Harley, just so you know, I have heard this conversation my prior 2 years, but it's always been kind of like there might be, and maybe Catfish Creek Watershed, maybe they will put money toward. It's always been kind of unknown and vague whether it was going to happen. But I know that Eric Schmeckel talked about it last night as it's going to go forward. So that's the basis for me of saying we should probably get that on the books so we can take advantage of the money while they have it. Is there a second to my motion for $550,000 for Swiss Valley Park stream stabilization?
I will second that.
Is there any further discussion? We have a motion and a second. All in favor signify by saying aye.
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 Aye. Motion carries unanimously.
I'm not sure the board's intent. I'm glad we carved that one out because it is a big one, but hopefully we don't have to go through every one of those. How do my colleagues feel about the design fees? It was part of the strategic plan to, improve the Swiss Valley area. I've been continuing to be warming up to the project. Originally, I wasn't as, jacked up about, seeking funding and or improving, drastically buildings. But I am in favor of the project, and it was, I believe, unanimous vote at conservation to include that. But it is dollars that are being invested that, you're going to have to get additional dollars to match in order to ultimately get it built.
Right. And my thought
So
would
that's
be,
kind of the risk.
yeah, Jay, my thought would be to put it in the budget, because if it can happen, I'd like to see it happen to begin. But I guess I would just say to Brian as a caution, I think we need to have a few work sessions to get some focus and implement here about how we're going to do this lift. Because if we can't actually do a redesign of that building, why did we spend $80,000 to get it surveyed and some structural things? So, I kind of see that some of this as, where do you dip your toe? Not that $80,000 is insignificant, but if we don't put something in the budget for this, well, I mean, I guess we could amend, but I guess in transparency to the voters, I'm interested in putting some money toward this in 22 to start the process of getting the planning done for that comprehensive plan. I'd like to see something being drawn. So how's that for feedback? Your thoughts, Harley?
Are you looking at, you said like 6 million, is that, new buildings down there, or how? I guess looking at the picture, I was kind of lost a little bit.
The entire project is a real realignment of our entire road coming into the nature center. And it is making an addition to the building and a little outdoor patio type space that the naturalists can utilize for programming or gathering of folks outside of the building. But yeah, it would provide a real rework of the building. And I never thought when we built this building that we'd outgrow it, and we have already from the 2002 plan. But yeah, so that's designed to give us information that we could go out and start fundraising for that total project.
So are we thinking we'd rather save this and have it be an amendment if we get traction on a committee? And
I would be up for that. I mean,
Are you kind of saying you need the design before you can get the
funding,
hopeful donations?
yes.
Okay.
And of course, my concern is we don't really have a plan to move beyond, right now, we don't have a plan to move beyond these kinds of bites that we're taking. And we can't do this lift for $1.5 million improvements to conservation. We will never get that comprehensive plan accomplished. We can't do it by ourselves.
No, I would be,
Yeah, I would.
oh, sorry, go ahead, Jake.
Yeah, I would generally agree. I think the comprehensive plan is the big and the long view over 20, 30 years, and it includes a lot of components. And so to think that just with local property tax dollars we're going to accomplish that, I don't believe anyone had indicated that was going to happen. The good news is it's just, I think over the last 3 or 4 years, we've received probably over $2 million from local, federal, state, and private entities. And so, the contribution that we received from John Deere was pretty significant on the proving grounds. The Timber Group and all of their private businesses have really shown that if there's a project they're interested in, they trust conservation, they trust the county, and have leaned in with private dollars. And then even the federal dollars related to bridges has been pretty significant over the years. And so we do have a track record of getting those funds and standing tall and saying, hey, we can actually execute and do these. So that gives me hope. But to be honest with you, it's kind of one of those things like, there's no guarantee you'll ever build that. And I've lamented a few times in my drawer, I've got a $200,000 plan on a building we never built that previous boards approved. And I don't want to do that again. So that's why I wanted to discuss it with the supervisors. I did vote for it at the Conservation Board. I did vote for all of these items, and I believe that it was unanimous with the budget that was presented to us. So I don't want to necessarily slash a bunch of the work we've done, but that's an area that maybe we can be, move a little slow on, or possibly a little more pragmatic with.
Yeah. I also see it here. It's on page 218 for whatever that's worth of the comprehensive plan, but the parking lot and entry drive redevelopment is a short-term priority, but that full price tag's over $2 million, according to what RDG was putting together. So this is a small piece of the puzzle. I just am not sure how it all fits together, I guess. So,
if that one item's a hold up, we certainly could work together, putting a fundraising plan together and getting a committee established and come back with that one. I mean,
right.
I can't speak for the Conservation Board, but that would be my recommendation for them.
Well, let's move on past that unless somebody wants to make a motion on it now. We do have, the begins with some equipment pieces. There's land acquisition. There's some way to group these so that we're not, looking at them line by line. If you know them well enough, Jay, to group them, or
yeah, where I'm at, I'm fully supportive of all of the items that are present and ready to make a motion to that effect, with the carve out of the design fees for the nature center. So the rest of them I'm very comfortable with and familiar with.
okay, so that could be a motion. Harley, are you comfortable? Do you need to go back and look at anything? The only other one, I guess I'd probably still support the naturalist, honestly. You included that, Jay, basically in your kind of consensus motion there. Harley, where are you? Do you want to take things slower, or do you know what Jay's talking about when he's saying he's just ready to approve everything except the $80,000
Right.
design fee?
Right. And what about the parking lot? Did we decide on that for the IPC?
I would like to put it in the budget, but I would like to have another work session and possibly, let's call it a public gathering for that. And then, even the naturalist, we'll have a couple other reviews. We'll have the personnel requisition and the ability to, approve or deny that as well. So it is a budgeting, and I'm supportive of all the items with maybe just, as I mentioned, the carve out for the design at this point.
Okay. I can second that.
Did you want to make that in the form of a motion, Jay?
I will do so, yes. I would like to make a motion to approve the fiscal year 22 department improvement requests for the Conservation Board as presented in front of us, with the exception of the Nature Center design for $80,000.
I will second that.
We have a motion and a second. Is there any further discussion? In discussion, just noting that we do have, Stella has it all highlighted. I think that's accurate from what I see. Any further discussion or comment? We have a motion and a second. All in favor signify by saying aye.
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 Aye. Motion carries unanimously.
Good presentation, Brian
Thank you.
and Nate. Strong and silent as ever. Love it.
Thank you, Nate, for being present.
Sorry, Nate, I didn't really shut up to give him an opportunity to speak. So anything you want to say, Nate?
You did good.
Thanks, Nate. Thanks,
Thank
Brian.
you.
Thank you, guys. I appreciate it. Thank you.
Thank
very much.
you. Okay, so does anyone need a break? I just want to throw that out there in case.
I would entertain a motion for a 10-minute recess.
I'll second that. Or I'll
I'll
make a
third it.
motion to break till 3:30, I guess. Recess till 3:30.
I will second that.
We have a motion and a second to be in recess until 3:30. All in favor signify by saying aye.
Aye.
Aye. We are at recess.
Tammy or Emily from Sunnycrest, will one of you be doing, sharing your screen? This is Dawn.
Yeah, I can share my screen.
That's Emily?
Yes, that's Emily.
Okay, I'll make you a co-host then.
Okay. Oh, cloudy.
It's 3:30, looking to see if we have Supervisor Wickham back with us. Give him another minute. There he is. All right. Stella, over to you then. We're back in session.
Okay, so next on our agenda, we have a departmental presentation from our Sunnycrest facility. So I'll turn it over to Emily and Tammy, I believe. You can go ahead and share your screen.
Oh, is it
Yep.
showing the right one?
Yep.
Budget, okay. Not pictures of me and my family?
Nope, you're good.
Okay.
Welcome, everybody and board members. We like to start our budget presentation out with some facility successes and some of our facility challenges, and kind of wanted to go through some of them. Many of them you may have been exposed to before. Some of the successes that we've encountered here at Sunnycrest Manor was our ability to rapid COVID-19 test to identify our schedules within the facility, to identify those positive cases quickly. Our facility assisted in developing a schedule, within team members that definitely helped to catch some of our cases quickly. Also, our facility utilization of space available to create and build our COVID-19 unit and some of our isolation areas. We needed to be pretty creative, but we were pretty successful in being able to distinctly differentiate those areas according to regulation. Also, our facility staff team efforts and dedication to meet our resident needs and to include the cross training of our staff and their efforts to do so through multiple departments and to assist one another. The utilization of our basic care aid course for in-house staff who are not CNA certified, and the approval to be able to hire those positions. That was a big help when we faced some of our significant staffing challenges, which would be on my other page as a challenge. Basic care aid position has also proven to be a pathway to become CNA certified, that we're able to sign some of those basic care aides up to then move into a position where they'll be able to be hired as a CNA here at Sunnycrest Manor. The basic care aide position is only approved while the pandemic is existing. So we've utilized it as an opportunity to help grow from within and create that pathway with some initial education that allows them to provide those basic care needs, and then to grow, which helps us to face some of our existing staffing challenges. Our increased use of technology to facilitate resident appointments and meetings, and to also maintain contact with families. And additionally, we've used much more technology to become involved as far as activities go. I think I've learned a couple new things along the way, so that's been pretty exciting too. And then the development of our chat box to allow resident and families visit. We did have an outdoor available option, but as the winter months became apparent, it was pretty neat, and it was something that our maintenance department had built us to use, and we were able to have it approved through the regulatory agencies and the fire marshal. So that was pretty exciting and successful for our facility. The development of creative activities to support resident social and emotional needs. Certainly the COVID restrictions have allowed, or I should say have not allowed, for the typical movement that we have throughout our facility. So our activities department has done an excellent job of taking activities to residents one-to-one and creating some of those different looking activities, virtual activities, but yet in a group or at the social distance. Our COVID-19 vaccinations, we've successfully completed 2 out of our 3 clinics, and we've had no significant adverse reactions. Thus far, we have 97% of our residents vaccinated, and we are still completing the staff vaccinations. Walgreens has let us know that we're kind of in the average group amongst other with other facilities. Also, our facility scholarship program, it has assisted greatly to promote the advancement in education and filling some of our charge nurse positions that in our past has previously been a challenge that we have faced with securing our nursing personnel. And we currently have 2 CNA staff that they had earned their LPN nursing degree within the last year. We have 1 LPN staff that has earned their RN degree. We have 2 LPNs that are currently working toward their RN degree that work here right now. And then we have several staff members who are also enrolled in the nursing program. And so it is kind of like a grow your own mentality, and they are remaining with us, those staff members that have gone. So that has been extremely successful for us.
Tammy, this is Ann. I don't want to just fly through that paragraph. That is really well done. So thank you. That's a big success that's working for Sunnycrest. That is a big deal. And I'm sure that's a lot to do with you being a mentor yourself as our director of nursing. So well done. That's well, good.
We are pretty excited. And I think they are pretty excited as well. And I think everybody, you know, it's pretty exciting to watch them grow and go from that level, you know, to move up to, and then to have that level of commitment to Sunnycrest Manor yet still. So pretty exciting, I agree. Also, the expansion of our skilled nursing services to include IV antibiotic therapy. We had a resident we're able to provide increased services, and that allow us for increased revenue within the facility. Obviously, we're in our infancy stages of that, but that's something that we will be looking forward to expanding on. And then our seeking out of grants. Emily has had several grants that have been approved towards the facility, and the facility is participating in the EPO program, and it benefits. It's very COVID focused and specific, and relates with other nursing homes, but it also provides significant education specific to COVID. And all while learning, we earn $6,000 towards the facility. And I know other local facilities are participating in that program as well. And so that is pretty exciting when you learn and you make money while you're learning. And then our successful auxiliary Christmas fundraiser, the facility has raised over $5,500 to benefit the Sunnycrest residents. And then we have the continued support of many resident families and friends, and donations that come in the name of our of residents and loved ones to continue to support their cares here. Some of our challenges, I could probably sum it up just by writing COVID across the page, and it probably could have been longer for what I wrote, but you know, COVID really has caused us to restructure our daily routines here. We've had several environmental changes. We've had fast-paced regulatory changes that we've needed to keep up with. And it's not just one agency, you know, it's several. And so there's a lot of regrouping that goes on with that. Obviously, we've had some resident illnesses here, and we have had 2 facility outbreaks, and we have recovered and we have moved forward from both of them. Staff illnesses, we have had staff who have tested COVID positive, and obviously that presents itself with some staffing challenges above and beyond even some maybe existing staffing challenges that we might even just face day to day. And the emotional effects on residents, their families, and staff. It's been, it's been difficult for all parties at the table. When you realistically look at that, we've been doing this for, a year now. A resident just mentioned to me today, Tammy, we've been in kind of in quarantine here in isolation for a year. And so along with that challenges, comes with us regrouping as a facility to, post-vaccination, we still have to adhere to all those regulations and safety matters. We still have to wear masks, remain socially distanced, and life as such is a little bit different yet. But as a facility, we're going to be meeting and moving forward from that. So looking at the reopening process, and when I say reopening, I don't mean to, visitors and everything, but just, making little changes to move forward that stay within those regulations. And then, restructuring of our activities. It's been a challenge. We've had equal amounts of successes with that. The less movement throughout the facility, and our residents' ability to leave the building. And then we've also had, we had started our east-west wing remodeling project through our board of trustees, and that needed to come to a halt when COVID came about. So that remains a challenge, mostly cosmetic right now, and we look forward to that. So that is currently on hold. We do have some pictures to kind of represent Sunnycrest Rocks 2020. Our residents each had the opportunity to paint a rock, and this decorates and adorns in front of our facility. So residents were busy on their one-to-one activities, making their own individual rock, and then collectively all putting them together in this picture. Our next picture, we have a resident. This is our chat box, our famous chat box. And we have a family member who had delivered their loved one some family pictures that they had requested. And one of our utilizations of technology, in the next picture, we have a resident celebrating a landmark birthday party, a virtual Zoom birthday party that their family put together for them with cake included. So in our next page, we have our outdoor gardening that we participated in the warmer months, and then also an outdoor socially distanced piano concert put on for our residents to enjoy. In our next page, we have a socially distanced campfire that we have with some treats. So our activities look a little different. That would typically be filled in with many people, but needed to maintain standards. And we have our resident president here who is doing some watercolor painting. And on the opposite side, we have another resident who is making cards for Project Rooted. And these cards are included in the free lunches that are provided to area children through Project Rooted. So she's working on cards for that. And then we had a Zoom Christmas sing-along in our family parlor area. So lots of fun and exciting things still going on at Sunnycrest Manor, despite some of the challenges and amongst many successes. And now we're on to the numbers, Emily.
All right. Do you have any questions for Tammy before I get started on numbers, or do you just want to wait? Anyone? Okay. I'm going to go ahead and get started. So first is fiscal year 21 reestimate. We did not make a change to our ask for fiscal year 21, though there was a lot of adjustments to our budget. We did have our current budget We had 9.6 million in revenue, 11.8 million in expenditures for the ask of 2.2 million. We had started the fiscal year with $400,000, and that was because of the HHS funding that we received prior to June of last year that we had not spent. So that's why we started with some money. Usually we try to get to zero balance of cash. So our revenue reestimate is 9.9 million. We received about $300,000 of HHS funds this year. That equates for the bulk or pretty much all of that increased revenue. Our expenses are up about $650,000. So it's a change of about 350,000 of an ask, but we started with the 400,000. So we just kept our ask at the same amount. This does not mean I didn't move a lot of things around. I just kind of restructured where we were. We, with our residents not able to go to ARC, that's been a big savings. But then we've had to put more towards staffing and wages because now those residents are at home. Same thing with RTA. There was a big expense annually that we had for RTA. That's obviously, since we're not utilizing them, that could be reallocated to other sources. So far this fiscal year, we've spent about 250,000 on COVID related expenses. And that is strictly the supplies. That does not count any wage changes because the wages are still going to the wage accounts. So I didn't break that out. Well, it's not broken out as a separate line item on the financial. So just, I could go through where I restructured. I did include all these numbers on a separate handout, but it's rather lengthy. But I did go through every account and look at it and move things around to try to not change our ask this fiscal year. So that I had staying the same. And then for our fiscal year 22 budget, we have a license for 77 beds. I have our budget at 91% occupancy, which would be 70 beds at our currently daily rate of $237. So that gets our nursing facility at revenue of about 6 million. Our ICFID, I have 96.4% occupancy, which would be 27 of the 28 beds filled. So that revenue would come in at just under 4 million. Medicare B revenue is just kind of an estimate based on prior years, and that changes and fluctuates based on our residents and what therapies they need. So as our residents changed or as their whatever therapy they need changes, that fluctuates. And so total billed revenue for fiscal year 22, I have at 10,150,000. We started fiscal year 21 with about 3 million in accounts receivable outstanding. Hope to get that reduced. That kind of, I don't know how to explain it. That's up and down as far as our balance. Sometimes we're paid within 30 days and other times it's 60 days. It's a continual fight with the MCOs. Sometimes we're denied for, they want proof of not being the primary payer, but that's for May, but they paid April, or they pay April, but not May. It's for the same resident. So it's just a continual rebilling and appealing. So that some of that's rather lengthy, but 3 million was considerably high. So we're hoping to get that down and hopefully to get a better handle on it. Quite frankly, has not been priority number one for me lately, but hopefully by fiscal year 22, I will be able to focus more on that and get that down and to keep it down. Board of Trustees contribution is budgeted at 100,000. Now, I'm not sure if you recall this, but the Board of Trustees reimburses the county for 100% of the maintenance director's salary and all benefits. So that would be the IPERS, the FICA, and then health insurance. And then also they reimburse the county for my benefits. So the county pays my salary, the Board of Trustees pays for my health insurance, my IPERS, and my FICA tax. So between the two of us, the county gets reimbursed about $100,000 from the Board of Trustees. Other revenue, it's just $12,000. That's cable that the residents pay for is a large chunk of that $12,000. Also, it's the rebates we get from Alliant Energy and Black Hills for the franchise fees. We get reimbursed those because we're government, but I don't budget much for other revenue. So that gets our total revenue for 2022 of $10,761,115. So on our next slide, sorry. Now for the expenditures, I did have a 5-page attachment. I've got probably 250, 300 accounts, individual line items that I try to merge together here to not have to go through every line item. So this is wages for the entire facility. They are budgeted for next fiscal year at just under 7 million. FICA and IPERS is 1.2 million. Health insurance, we have that at 1.75, and that is, I did a 10% increase from last fiscal year, just based on our current membership in that. For other employee expenses, that's 111. Now that's going to be like work comp, insurance, unemployment claims that we have to pay, physicals, background checks that we have to do for new employees. The cost allocation, that is the allocation we get from that cost allocation services report for Sunnycrest portion of IT, personnel, auditor. I think there's a couple other small ones, but those three are the big 3 departments that we get allocations from. COVID related supplies, 475,000. And I'm just mirroring what we're roughly going to spend this fiscal year. If I annualized out what we've spent, hopefully that is not so high, but that's my best estimate on that. Utilities, just over 300,000. Food is just under 300,000. That ICFID assessment, that is the 5.5% of revenue we receive for ICFID services. That's just the daily rate that we receive. Contracted services is the bulk of that's the laundry, the Aramark laundry. We still use Aramark for that. And that's for our flats. We do our personal resident laundry here, but it's the sheets, the washcloths, the towels, and all of that. And also a couple other things is our medical director is contracted, our dietitian is contracted, and those are in that number. For programming expenses, this is where ARC money is budgeted. That's the bulk of this 210,000. I'm budgeting as if we will be back at ARC because that's our hope. But if not, we'll be able to move those funds around for increased staffing in the ICFID unit or additional programming supplies that we could do in-house. Therapy is, that's again, like I said, with the revenue on the Medicare B therapy, it's that's basically just based on our residents, and I'm using what we're kind of spending this year, even though our therapy is limited. But if this amount increases substantially, so will the Medicare B revenue. It's basically a wash with therapy, what we spend and what we get back after we pay for billing and all of that. So medical needs is 161,000. These are just regular medical supplies, non-prescription medications, incontinent products. Again, this fluctuates based on our current resident mix. Transportation of 108 is RTA. Again, I'm assuming we're going to be back to using RTA every day. So that's where that money's coming from. Education for the entire facility is 91,000. I did keep the 50,000 in there that we had hoped for the nursing scholarship. I think we've only spent about 5,000 this fiscal year. A lot of it probably because classes we weren't sending anyone to CNA courses this year because those were on hold. So we hope to continue that program. Liability insurance, I think I did about 10% increase from last fiscal year. And then the others, I just kind of merged the rest of the smaller accounts within building and equipment. So that's just minor equipment repairs. The trustees pay for the major equipment repairs and building repairs. So that's about 50,000. Business office, this is going to be your our Point Clear. That's our software that we use. That's our attendance enterprise timekeeping software. Postage, office supplies, that's that type of thing. Environmental services, that's just your housekeeping supplies, just additional, some pillows or, things like that we have to buy and just replacement. And then dietary, that's anything non-food and dietary. So that's your just replacement dishes and just other non-food items that dietary uses. So in total, our fiscal year 22 budget, I just repeated the 21 that I talked about before, but for comparison, I have them side by side. So revenue, we've got 10,761,000. Expenditures, we've got budgeted right now at 13,219,000. So the need would be about 2.5 million. And then, so we had like 60,000 left from fiscal year 21 of the 400 we started with. So our ask would be just on about 2.4 million for fiscal year 22. And that's all I have for that. So do you want me to go through any of the other line items, or did you review that prior to now that you want to see?
Emily, my question to you is, I guess, a little bit more in terms of interaction with the county. And can you just kind of explain what is your relationship with Stella, our budget director for the whole county? How often do you visit with her? I mean, how does this work? The two of you, I mean, you know, how aware is Stella of all your needs as you go along?
I don't think we frequently speak, but whenever I have questions or if she has questions, we communicate. We don't have like a monthly set meeting that we discuss what's going on.
Mhm.
I send her all of the monthly financials for the advisory board. So I guess I'm
not
lacking
suggesting. Yeah. I'm not suggesting you're not doing a good job. I just think it helps tell the overall story that, you know, you're giving monthly budgets to her, any CARES Act or any federal funding. I know you're taking care of that, but is that being reported to Stella as well?
So I have a running spreadsheet for all of my expenses that I'll be honest, it's not completely up to date, but I keep that updated, and then every COVID related invoice I put on that spreadsheet for my tracking, I upload it to, I don't know, the folder that Stella has given me to put all my copies of all my invoices in. Stella's aware when we receive any money. And I intend to do all the reporting for that's due on February 15th, and I haven't started that yet, to be honest, because now that this task is over, that's my next big thing. So I'm not sure how intensive that's going to be, but
What is that report, Emily?
It's all of the HHS reporting requirements. And since we received money, I think we got 6 different payments, and these are all different. Some things I have to, I've read the terms and conditions when I accepted these, but truly it's, you know, infection control money, that was 121,000, and that has different requirements than the just general skilled nursing facility payment. And we also got money for the ICFID unit they all just have little different things. I'm gonna have to report to prove that everything was COVID, that I can tie it back to COVID related expenses. And I had submitted an application for phase 3 of the funding based on our expenses. And that was really enjoyable because I had to flip to accrual based, and we don't operate accrual based. So that was rather time intensive to find out that we didn't receive money because of our daily rate increase for fiscal year 21. Even though we were down 425 bed days, we in fact did not lose money because of our increased revenue and so they did say that of the 70,000 people that applied for phase 3, 35,000 did not get funding because you would have had to meet, it was 80, we had not lost 88%, or we hadn't, I'm sorry, I'm not wording it right, but yeah, we didn't qualify.
You didn't lose enough money. People had to lose a lot of money.
Yeah, even though I could have turned around and said, well, these 425 days were actually bed loss, but
So I guess another general question to you, and you talk about your year, Emily, have you been involved in, I know it's kind of an all hands on deck kind of attitude. Have you been involved in areas outside of the fiscal department just to help with Sunnycrest?
Not normally. I mean, I did come in on a Saturday for about 8 hours and moved everybody. That was interesting because I've never been in all the residents' rooms. So I helped box up all their personal belongings. And, you know, that was a big day when we made some changes. And it was now, you know, we had a COVID positive and we had to set up a new unit. Not substantially. I've helped more, I helped set up the COVID unit before it was there. You know, I go down there and do stuff. I've helped in other areas, but not a lot. I've got a lot of extra work to do as it is with my
Well-
COVID tracking.
Yeah, and I was gonna also ask what's the burden on you without a full-time administrator?
It's a lot of it's a lot of extra hours. It's I didn't realize how much of the HR functions Chris was doing, to be honest. So that's just very time consuming things with the background checks and following up and submitting a lot of stuff. But so that's something that's been pushed to my plate. So that's in addition to COVID and additional extra tracking, I've been working a lot of extra hours. So, but I also had someone in my department on maternity leave, which it was just kind of the perfect storm here at Sunnycrest. So it was, I've been putting in more time, definitely more than I want to. I'm ready for it to be over.
Yeah, we are all ready for it to be over, but some people have been impacted a lot more than others, and that's just true. So
Yeah.
I'm pleased with your budget. I don't have any specific questions about the budget. You know, I always want to offer to see how there's any way that I can help you with federal reporting, but I don't know how we could do that by February 15th. But if you think of something, you know, please ask.
Mm.
Supervisor Potoff, do you need us to go into some issues? Emily can answer any question.
I was just wondering about the accounts receivable. You said that was like 3 million.
Yes, at the end of fiscal year 2020, fiscal year 20.
From June 30th of last year.
Correct.
Okay.
And it's down. It was at the end of December, we're down to like 1.3, but it fluctuates so much. I could go another 3 months with having trouble getting payment. And then all of a sudden they start to pay me right away. And then I have to time some of it. I've found with the MCOs, it's a lot easier to hold it until hold billing until I know all my corrections are coming in. So we have annual reviews. Well, it's on hold because of COVID. But so everyone who lives here, let's say we get for nursing facility, we get about $7,000 a month from Medicaid for them to live here. Mm-hmm. Depending on what their Social Security amount or their revenue amount is, they get to keep $50 for personal needs and the rest goes to Sunnycrest. So if this individual has $1,000 Social Security payment, they pay me $950. Medicaid pays me the other $6,000 to get me to $7,000 for that individual. If someone has no Social Security income, they pay me $0. Medicaid pays me $7,000. So in January, all the Social Security amounts go up. So all of the client participation changes. So definitely January, I will be holding until DHS has everything updated 100%. Otherwise, I'm paid incorrectly from the MCO and I'm fighting to get a $12 difference, you know, but the $12 difference on 100 people adds up. So it's not something I can ignore. So there's certain times like that I hold the billing. Definitely January is going to take a while to do because I've got about, I'd say 70% are good. The other ones we're waiting for medical associates premium increase of $2 and I have to get it fixed. So there's reasons throughout the year I hold it or people get money, like a life insurance policy from a family member and that needs to be updated with DHS and then they typically don't get to keep that. So there's little things throughout the year that I hold billing because I've found if I submit it as it is and then try to go back and have them reprocess it, I'm unsuccessful. Then I'm wasting hours to reprocess and send proof. And so that's part of it. You know, it's down really low right now because everything got caught up in December. We were good and they haven't done reviews because of COVID. They had those on hold. So now January, like I said, we had a big change and it'll take a while. So every year it's kind of up and down like that. I hope to keep it down, but COVID's been the focus right now. So hopefully by the end of next year, I've got a really good handle on it and it stays down and the MCOs pay me every time. That's the perfect world, but.
We're not talking accounts from 5 years ago. We're talking, okay.
Months. I mean, it can fluctuate.
Reasonably current, it's just backlogged.
Yeah, and it's all Medicaid money. It's not, we don't have well, we do have some problems, but not many problems. We don't have a lot of private pay people here. So it's Medicaid that owes me the money. It's money we're entitled to. It's just getting them to pay me the money. So.
Okay. That was my only question.
Emily, how far behind is Medicaid normally? How far behind would you think it is?
Some months I'm paid within 30 days without a hiccup, and every claim is paid. The next month, they'll deny half my claims saying Medicaid's not the primary payer. Medicare is, send us proof what Medicare paid. And then we have to appeal. You know, Medicaid is primary payer for room and board, and please reprocess. Then they reprocess, they pay half of those. You know, I don't understand. It's one claim will come in and they'll, you know, I might bill 2 months at a time and they pay for February for an individual, but they deny January for that same person. Same billing code, I don't have an explanation to why they get denied. I truly don't. But it's when it gets denied, it takes a lot of steps to get our money because they have to be individually appealed, and it's kind of ridiculous actually, but
Okay.
I've only ever known MCOs. Prior to MCOs, we billed Medicaid directly, and I hear that was fabulous. But since I've worked here, it was always the MCOs. So.
Okay.
Do we have other questions for Emily? And were there any questions for Tammy Freiberger?
No questions for me, just Emily and Tammy, thank you for your presentation and your service. Appreciate it.
Thank you.
I would echo that. Thank you very much, Tammy and Emily. And thanks for the great job you're doing up there.
Thank you.
Thank you both. Stella, do we need to take any action?
You could take action to approve the ask, but it will be in the budget. So also the approval of the budget will be the action. So if you want to take specific action on the, excuse me, contribution to Sunnycrest, we could do that.
Is there any discussion about the contribution to Sunnycrest? Is there anyone who feels we shouldn't do this, or there's something we should be pursuing? I certainly feel we should continue, and the increase is modest, less than I had expected.
Mm-hmm. A very modest increase, so.
I don't hear a motion, so I guess we will defer that onto the budget.
I do want to ask, we do have 2 departments left, the county attorney and facilities, since the Board of Health, and also a publication or procurement. So I'm wondering if we want to move maybe facilities to next week in the interest of the Board of Health meeting at 5 o'clock and the thing still on our agenda. So I just want to throw that out there.
I'm fine with whatever you need, whatever you suggest. Jay and Harley?
That's fine with me.
Agreed.
Okay. So we'll plan to reschedule the facilities discussion to next week, probably Thursday, and then proceed then with the county attorney at this point. So I saw CJ. Yep, there he is. Hi,
Good
CJ.
afternoon, CJ.
Hello, how's everybody doing?
Good.
Hey, CJ, how are you doing?
Well, the update, Harley, is this. So I got tested earlier this afternoon and I'm negative. Now go figure that. It just,
Positive blood, right?
I don't know what it is. Seriously.
Well,
This-
it's good. It's good that you're physically fit, so you can run the whole household, CJ.
Yeah, well, actually, Ann, I think my poor wife was in sort of a conundrum, right? Because I think on the one hand, she really didn't want me to have it, of course. But if I had it, then we could all be together. So now she's stuck with the kids by herself, and I'm down here and living in my own basement instead of my parents for the next week.
No, better safe than sorry.
Oh, absolutely. So anyway, but yeah, we'll manage.
Well,
So-
welcome.
Well, thank you. Yes, thanks for having me. So My budget presentation is a little boring because, we don't have any income in my office. So it's a relatively one-sided. And just to kind of start, about 70% of the budget is wages and salaries. And so the rest is just, kind of just general operating expenses. Just a few things that, kind of on the second page there, Stella, where it starts with the 1120, like in the third column, right in there somewhere. Yeah. So that, we still have this relationship, if you will, with the child support recovery unit. And that's what those lines are. So that money, but we get reimbursed by the state of Iowa. So it's kind of an odd situation. Before the state took it over, it was a county operation. Child support recovery was. So it's still there. It's about 191,500 is what I came up with. But like I say, we get reimbursed from the state for that. So it's kind of just a flow through. Other than that, we pretty much kind of as a status quo, all we did was add 2% really for the wages, right? Stella, is the only increase overall.
I didn't change any wages yet, but I did increase benefits by about 5% in every department.
Okay.
So that's
to cover that.
Adjusted so far.
Oh, okay. Gotcha. Other than that, I mean, we, our year, like everybody's, I'm sure you've been hearing through all your sessions, was kind of a big COVID, shift. We had people working out of the office about 10 weeks from March there till June, and then another, about 12 weeks here from the latter part of September. We just came back Monday because, there was the kind of the resounding thing was court delay, and they've really kind of, I don't think there'll be any more delays. We were going to start trials on Monday. They'll been resolved one way or the other, but so I think we're going to be moving forward with jury trials just as we have in the past, and I know the court is going to be also starting civil jury trials. I hope that adds maybe a little bit of normalcy to the operation, but it'll be obviously really different. Just how we handle all those people. So logistically, IT has been a great help. When we had one jury trial in September when they started up and then shut it back down. But IT was, as they always are, they were a great help, and we got through that in pretty good order. So we've had to kind of make our way through things as best we can. But gosh, other than that, really, it's been a year of just trying to move forward. We've had couple retirements. A couple of the support staff retired. I think there's another one's gonna give us her. She's the second last part-timer. I think she's gonna retire here next week or so. Give us our notice rather. But we, if you'll recall, after one had retired in the summer, then there was a full-timer and a part-timer. We replaced those folks with two full-timers. So when this part-timer retires, then that'll get us back to square one. So we'll be in good shape there. Really, other than that, we don't have too much else that's out of the ordinary from last year, to be honest with you.
How is your own search for personnel going? And
that's Supervisor McDonough. I don't have really an answer why we don't get much in the way of response. It's kind of, I think, for the last, even before I began my administration, I think it was that way for the last couple of years before that. Just not many people applying. For these last spot here, we had like 3 people, and I just don't quite understand. My own personal opinion is I think it's sort of like all law enforcement. I don't know if people really want to do it. I think it's hard for people to, put people in jail, put people in prison. I just think it's a line of work that, maybe perhaps for the younger generation coming to don't want to be part of that, which is sad. But how else to,
They want to move on to the firms where they probably make a lot more money. And
yeah, you know, Supervisor Potoff, I mean, I think, you know, on our starting end of things, I think we're very competitive. You know, especially with this new contract, and, you know, certainly our benefits are probably, I mean, I would say way better than most, maybe a lot of private firms and things, but I don't know. It's kind of hard to explain. But, you know, we can look
CJ,
in.
this is Dawn.
Yes, Dawn.
When we posted your positions, we actually spoke with one of the recruiters, and
Oh, yeah.
the first comment, because we did Sunnycrest out there as well to do it to cast our net a little bit wider, and he had more confidence in the Sunnycrest one because he mentioned with you know, county attorney's offices, it is that stigma of law enforcement.
Yeah.
And I know the last couple ones of your hires we've taken from other counties. And then we've also lost one to another county. So it's not like we're pulling them from the private sector. We're pulling them away from other public entities as well.
Yeah. And you know, I mean, Dubuque is a great community. There's many people moving back, right? So I just, it's hard to put a, you know, kind of a thumb on really what the hang up is. I don't know.
The sheriff is having those pains as well. He has for the deputy sheriff position. It closes next week, and so far he has 11 applications.
Right. And
it's been an ongoing trend for the last few years. It just, you get 30 or 40 people to sign up, and only a portion of them show up, and generally half of them fail the written, and you're down to, you know, that half, and then half of them don't make the physical, and so you're down to 5, 6, 7, and by the time you do the background, you're down some more. And
right. Yes, from talking to the sheriff and the chief, I think the same thing. They used to test what, Supervisor Potoff, once a year maybe before.
Every 2 years we used to do.
Yeah,
and now can't get a list to last a year.
Right, and that generated a waiting list, right? And now I don't. They're testing multiple times a year and don't have much of a waiting list. So I think it's kind of maybe you know, a trend through just law enforcement in general. It's so, you know, we just keep plowing ahead as best we can, of course, every day. So hopefully something will come along. So all I can say.
How many positions you have to fill, CJ?
So we have just the two attorney positions, Supervisor. Yeah. So that's what's out there. But other than that, you know, we really, like I say, there hasn't been too much else happening out of the ordinary. We, you know, we had gone through our, you know, electronic conversion in 2019, so that's all done. And I tell you, that was, I mean, looking back on that, I mean, I thought it was a good idea before or when we did it, but it really proved itself during this COVID time when people needed to work remotely. I don't know how it really would have worked, other than they would have been probably coming to the building in the morning and picking up a whole bunch of files and then bringing them back at the end of the day and getting the next pile for the next day, and et cetera, et cetera, et cetera. And we really have, you know, been able to do well with that. So that was a great help. And one other thing, and I know, Dawn, you and I have talked about this, I'm still gonna get on with the getting all those files out of storage and getting those electronically stored. I just need to get going on that and get that moving a little more steam. So I don't know if you
yeah, CJ, that's actually that idea of getting electronic things scanned and into a database is something that other departments have mentioned to me as well. We might need to do some contract hiring to get some of that done, whether we have the equipment or we use the equipment, but that's kind of becoming a recurring theme.
Yeah, it really is. And I mean, it makes sense. And there's, we don't need those papers anymore. And, some of it, quite frankly, with in our system, our world, the EDMS with the court filings, all the court filings are there. So some level, I mean, other than, and we're down to about, I think 10 years worth now. We've culled all kinds of stuff probably over the last couple of years now. So I think we're at a point where what we would be storing is really the end of it, because since then we have everything electronic for the last 2 years now. So, again, and they're all across the street over there in the Kirby building, which nobody likes going over there, but so that would help that too, I might add. So,
Right. Maybe you can mention that, Dawn, at a department head meeting to see if that's something that there's at least, some.
Good idea.
Maybe there's some commonality of this request and we should be looking at it.
Yeah.
Absolutely. And we've worked with a great vendor through roads and zoning out of Cedar Rapids. We did an RFP process through that, and they were low bid, and we were very pleased with their service as well. And I had spoken with CJ about that as well. But yeah, there may be some other departments. I know, like the recorder, they've gone on and have gone through their own vendor that specializes in theirs, but there may be opportunity for others as well. So yep, I'll bring that up.
Okay. Very good.
Yep. So that's kind of where we're at. I know it's a little boring, but it's kind of one-sided. It's kind of all
Right.
devastated, right, Stella?
Until you get staff right, there's not really, you don't have the ability to do all the things that I know you want to do, and I'd like to ask you questions about that are future thinking. And but we got to get staff right, and that might we'll see. I'm happy to have a conversation. I don't know what I could lend, but other than I sympathize with you tremendously, as those are my days at Iowa Legal Aid, right? We were constantly interviewing and trying to find folks that would come and do that work.
Yep. Well, hopefully there'll be a turn here.
Any questions for CJ?
I have nothing.
I have nothing. Just wish you and your family the best.
Oh,
Good
thanks,
health.
Jerry. Yeah, thank you very much.
Thank you, CJ. Appreciate
All
you.
right.
Appreciate you being
Take care,
before us.
CJ.
Thank you.
You bet. Take care, everybody. Have a good day.
You too.
Bye-bye.
Okay, so we're going to move facilities discussion to next week. So the final thing on your agenda today is a procurement procedure. And let me stop my share. Mary, I believe you placed this on the agenda. Do you want to discuss what this is?
Yeah, this is for Sheriff Kennedy. He's ready to go out for RFP for the building that is going to be out by the West Campus.
Okay.
And this is just the request to put in the newspaper. And then the bids would be due on February 26th and opened on March 1st at the board meeting.
Okay.
I will make a motion to approve the publication for the RFP.
I will second.
We have a motion and a second to approve the request for RFP. Any discussion? All in favor of the motion signify aye.
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 Aye. Motion carries.
Okay, so that's everything on our agenda for today. So for budget purposes, we'll be back on Monday at 1 o'clock, but I believe you have a meeting at 9 a.m. before that.
Right. Actually, we have some work sessions we have work sessions with Anthony. Always likes to come in bright and early.
Yes.
So we need, I believe, Mary, I'm going to call this as an adjournment until Monday.
Make the motion
So
to
moved.
adjourn.
I have a
I will
motion and a
second that.
second. Motion and a second to adjourn for the weekend until Monday. All in favor, say aye.
Aye.
We are adjourned. Thank you, everyone. Be well. See you next week.
Thanks, Ann. Thanks, Jay.
Everyone.
Bye-bye.
You, Stella.
See ya.
Thanks, Don. Thanks, Mary.